allowed to push back the cord back to the vaginal canal. Okay. How about letter B? Letter B states, gently reposition the prolapse cord back into the vaginal canal. Same. You could not reposition and put it back, the umbilical cord into the vaginal canal, basically because of you might introduce infection. Letter C, position the mother in semifallers to enhance circulation. Or letter D, cover the prolapse cord with sterile gauze, soak in sterile saline, and place the patient in Trendelenburg position. Remember, what is your position? What is the best position for our patients who are experiencing umbilical cord prolapse? Okay, our best position are, you only need to use your Trendelenburg position. Okay, Trendelenburg position. And you will also, if there's no Trendelenburg position in the options, in the choices, you may also use your knee chest position. Okay, your knee chest position. Okay, so those are the positions that are we are using if the patient is having umbilical cord prolapse. Okay, we are not allowed to insert back the umbilical cord back to the vaginal canal. Okay, we have to make sure that there is no infection. That's why we have to cover the prolapse cord, okay, so that the cord will not get dry, and soak the OS, okay, OS or the gauze in saline solution, and then place it in the prolapse cord. So, and place your patient in Trendelenburg position. So that is letter D. Okay, very good. Okay, let's proceed with your number 12. Nurse Kelly is closely monitoring Mrs. Lee, who is undergoing labor induction. Okay, what is your labor induction? That means the patient is given oxytocin for fast contractions. As the induction progresses, Nurse Kelly remains vigilant for any signs that could indicate a complication requiring prompt attention. What should Nurse Kelly be most watchful for? Okay. A, uterine hyperstimulation. B, signs of low blood sugar. C, intense severe pain. Or the prolapse of the umbilical cord. Okay, now, if you will be giving induction, okay, induction of labor, you will be giving units of oxytocin to the patient. Okay, what is your oxytocin for? Remember that your oxytocin will help the patient, the mother, the laboring mother, to enhance her contractions. Okay, so basically we will give oxytocin to patient if the patient is has hypotonic contractions. Okay, hypotonic contractions. Okay, if you say hypotonic contractions, these are your slow, okay? Slow contractions, okay? So basically, you will give your oxytocin, units of oxytocin to the patients in her IV so that it will enhance the contractions, okay? So if you will be giving the units of oxytocin, you will also remember that there might be, okay, there might be an instances that the contractions will will turn to hyper contractions, okay? Because you're giving a lot of oxytocins. Okay? So what will you need to pay attention for, and what do you need to watch out for is the contractions. If you are giving oxytocin, units of oxytocin to the patient, you have to monitor the contractions, okay? So if the contractions, okay, if the contractions will last more than 90 seconds, okay, more than 90 seconds, make sure, okay, what will you do? That is already okay, hypertonic contraction. So if there is hypertonic contractions, what will you do? You have to, okay, you have to stop, okay, you have to stop the IV fluid. Okay, so you have to stop giving the medication to the patient. So basically, if you will say labor induction, what should the nurse Kelly be more watchful for? That is your letter. Okay, that is your letter A, uterine hyperstimulation, because it might lead to your hypertonic contractions. If there is hypertonic contractions, then stop the IV infusion. Okay? So that is your 112. Okay, let's go to your 113. Okay, 113. Nurse Ava is conducting a vaginal examination on Mrs. Thompson, who is in active labor. Suddenly, Nurse Ava notices the umbilical cord protruding from the vagina. What should be her first action? Okay, first action if there is cord prolapse. Okay, if there is cord prolapse, what will be your first action? A. Quickly locate a phone to urgently page the physician. Okay, remember this one, nurses and midwives, do not call the physician right away without you doing anything first. Okay? So do something. Okay? Do something. Letter B, carefully attempt to reposition the cord back into the vagina. The big no, no, no. Okay? You might introduce infection. Letter C, notify the delivery room staff for immediate transport. And letter D, position the patient in Trendelenburg position. As I've said, the first thing that you have to do when it comes to cord prolapse, you have to position your patient. Okay, it's either Trendelenburg position or knee chest position. So that is letter D. Okay, very good. Next, 114. A nurse is assessing a patient in labor and suspects a cord prolapse. Okay, again, a question about cord prolapse. Which of the following signs would most likely indicate this condition? Okay, cord prolapse. Letter A, an irregular contraction pattern. B, severe maternal back pain. C, an increase in maternal blood pressure. Or D, a sudden decrease in fetal heart rate after membranes rupture. Okay. So the question asked about how will you suspect if there is already cord prolapse? Okay, how will you know if next to this is a cord prolapse? Okay, basically remember this one. Remember that if there is a rupture of bag of water, okay, remember because your amniotic fluid is the one that helps your umbilical cord to not be impeded, okay, so that it could still give good oxygen to the baby. So basically, if the amniotic fluid will go out on the vaginal canal, then most probably your cord, your umbilical cord will also goes out to the vaginal canal. So one of the reasons of your umbilical cord prolapse is the rupture of membranes. Okay, so that is your letter D. A sudden decrease in fetal heart rate because there is a rupture of membrane. So when the cord will go out to the vaginal canal, okay, basically the cord could not give a proper oxygen to the baby. So that would lead to your fetal distress caused by low or decreased fetal heart rate. Okay? Now, let's continue. Number 115. Nurse Tanya is monitoring Olivia, a 28-year-old patient diagnosed with hyperemesis gravidarum. Okay, what is your hyperemesis gravidarum? This is your vomiting, okay? The vomiting, which is usually, you know, pregnant women in her first trimester, they usually experience vomiting, okay? Nausea and vomiting. But those are just under first trimester. But if they will experience that in the consecutive trimesters, that means there is already complication. So that would lead to your hyperemesis gravidarum. Okay, aware of the potential complications, Nurse Tanya understands that Olivia is at risk of developing which condition? Okay. Is that letter A, placenta previa, B, electrolyte imbalance, C, gestational diabetes, or D, hypertension? Due to vomiting, all her um, nutrients, okay, so the women, okay, your hyperemesis gravidarum, the women will basically experience low potassium, low calcium because of the persistent vomiting. So basically, those will lead to your what? Those will lead to your electrolyte imbalance. That is your letter B. Okay, 116. A 30-year-old client who recently had a hysterectomy. Okay. What is your hysterectomy? Okay, everyone, what is your hysterectomy? Okay, what is hysterectomy? Okay, what is your hysterectomy? What happens during hysterectomy? Okay, what happens during hysterectomy? Any representative from the group? Okay. What is your idea? What is your hysterectomy? What is that? What happens during hysterectomy? Let's define first. What is your hysterectomy? So that we'll be able to answer the questions, okay, correctly. So you have to define what is your hysterectomy first. Okay. What is your hysterectomy? Okay. Any representative from Padang, Tanjung Karang, Jambi, Aceh?
Ada yang mau ikut
Okay.
jawab? Apa itu hysterectomy? Apakah harus dipilih? I think we can pick one of them, Miss.
Yes, I think we can call any someone.
Okay.
Kak Atika Rahmadani dari Jambi. Oke. Kak Atika, boleh di-unmute. Apa itu hysterectomy? Simpelnya aja
Oh,
bisa
okay.
pakai bahasa Indonesia juga nggak apa-apa. Boleh pakai bahasa
Okay.
Indonesia.
There.
Izin menjawab, Miss. Hysterektomi itu prosedur medis untuk mengangkat rahim.
Okay, so the removal of the uterus of the womb is what.
Okay. Very good. Who is that? Who is that?
That Miss Atika. Can I add? Oh, there.
Okay, very good. Yes, your hysterectomy is a removal of the uterus. Okay, so remember that your uterus is the one being has a vital role, especially in your menstruation, in pregnancy. Okay, so basically your uterus is very important. So if you say hysterectomy, this is the removal, okay, removal of the uterus. Okay, so visits the health center and ask Nurse Anna when she should perform breast self-examination. Okay, your BSE, your breast self-examination. What is the best time for her to perform BSE? Okay, A, on the same day each month. B, during menstruation. C, before menstruation, and the 7 days after menstruation. Okay, let me see your answer. What is your answer in number what number are we? Okay, in number 116. Okay, what is your answer in number 116? Okay, let me see your answer. Okay, A. Most of you answered letter A. Okay, how about the others? How about the others? Okay. So if you say BSE, usually we're performing our BSE not on the time of the menstruation, because if you will be doing that, it might be you will feel some lumps during the time that there will be breast enlargement if you will be having your menstruation. Okay? So it will alter the result. So what we have to do during BSE is we have to do our breast self-examination after menstruation. Okay? So that's after menstruation. Okay, but in our case, in this situation, your patient is having hysterectomy. So that means her uterus is already been removed. Okay, so the patient has no uterus at all. So what will you do? Do you think that the patient could still experience menstruation? Yes or no? Do you think that the patient could still experience menstruation once the patient is having hysterectomy? Okay, could you think that the patient could still experience menstruation if her uterus is already removed? Yes or no? What is your answer? Okay, what is your answer? Do you think? Okay, from Jambi, Vidya says no. Yes, that is correct. Okay, because the uterus is where menstruation takes place. Like for example, your uterus is being the one being thickened by the progesterone. So basically, it will slough off during the time of if there is no fertilization that takes place. So that is the work of your uterus, and that is how important your uterus is. So if there is no uterus, basically no menstruation will happen to the patient. So the the thing is, you don't need to wait for after menstruation, okay? After menstruation, because no menstruation happens during the time of if the patient is having hysterectomy. So basically, the best answer is your letter A. You can do your BSE on the same day each month. Okay, so that is your letter A. Very good, everyone. Okay, let's go to your 117. Nurse Thompson is educating a patient with a history of recurrent mid-pregnancy losses. Okay, she discusses the treatment plan, which includes activity restrictions and a procedure to reinforce the cervix. Okay, the treatments are most appropriate for which condition? Okay, what is this procedure that we do to reinforce the cervix? What is that called? What is that procedure called that we reinforce the cervix? Okay, what is that procedure, everyone? What is that procedure we do, okay, if we will reinforce the cervix? Okay, the procedure. What is the name of the procedure? If we will reinforce the cervix, because the cervix will open, it will open. Okay, so basically if the cervix will open, it will not hold pregnancy, so that would lead to abortion. So what is that procedure? What is that procedure called? Okay, what do you think? What is your answer? Okay, any representative?
Ayo semuanya tolong ikut jawab ya. Kalau misalnya di chat,
Okay, very good. From Ache with Dia. Okay, very good. That is your cerclage. Okay, so that is your cerclage. So the procedure called to reinforce the cervix is what we call your cerclage. Okay, in your cerclage, we have two types, right? Okay, we have two types of your cerclage. The first one is what we call as your, the first type of your cerclage is what we call as your, okay, what do you think? The first one, the first type of cerclage. Very good. From Ache Dila, which is what we call as your McDonald. Okay, McDonald. Okay. So if you say McDonald, is this permanent or temporary? Okay. What do you think? If you say McDonald, Dila, is that permanent or temporary? Okay. If you say McDonald, is that permanent or temporary? Okay, what do you think? Your McDonald's cerclage, is that permanent or temporary? So basically, we have two types, right? The permanent and the temporary. So you think, what do you think? If you say McDonald, is this permanent or temporary? Okay. 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 Very good, Dela. From Ache, that is temporary. Okay. This is your temporary cerclage. Okay. How about the second one? The second one, the second type of cerclage is what we call as your, the second type of cerclage is what we call as your, okay, let me see your answer. Okay, the second type of cerclage is your, very good. That is your shared car. Okay, your shared car. So, your shared car, this is your permanent. Okay, this is your shared car. Okay, this is your permanent. Okay, very good. Okay, so if you say that you're doing this procedure, what is this procedure for? Okay, is that incompetent cervix, placenta previa, hydatidiform mole, or abruptio placenta? So basically, that is your incompetent cervix. So the answer is letter A. Okay, very good. Number 118. Okay, in your 118, Nurse Karen, okay, Nurse Karen is discussing the characteristics of an incompetent cervix with her patient. Okay, incompetent cervix again. Which of the following are true regarding an incompetent cervix? Okay, A. It typically becomes problematic during the first trimester. B. It usually resolves on its own by third trimester. C. It is treated with hormone therapy to prevent further cervical dilation. And your letter D. It is often associated with painless cervical dilation in second trimester. Okay. So, the question is asking about your incompetent cervix. Okay, so let's try to analyze and rationalize the choices given. Okay, let's start with your letter A. It is typically becomes problematic during the first trimester. Okay, does your incompetent cervix happen usually in first trimester? Okay. So this is not just problematic in first trimester. This will also happen in your second trimester. Okay? And how about letter B? It usually resolves on its own by third trimester. Do you think if you will be having incompetent cervix, do you think that it will resolve on its own without doing any procedure? Yes or no? That means no. Okay? Because basically if there is incompetent cervix, we have to do the procedure called as your cerclage. And your letter C, it is treated with hormone therapy to prevent further cervical dilation. Is that hormone therapy that we will be doing? What is that procedure called? This is your cerclage. Okay, cerclage. This is a nylon suture placed in the cervix to close the cervix and to end so that it will hold the pregnancy. So the best answer is your letter D. It is often associated with painless cervical dilation in the second trimester. So that is letter D. Okay, let's go to your 119. Okay, 119 question is Nurse Lewis is assessing Mrs. Rodriguez, a 32-year-old pregnant patient in her third trimester who presents with sudden severe abdominal pain and heavy bleeding. Nurse Lewis suspects a condition where the placenta detaches prematurely. Okay, the placenta detaches prematurely. What condition is characterized by this serious complication? What is that? The placenta detaches prematurely. Is that your abruptio placenta, ectopic pregnancy, incompetent cervix, or your placenta previa? So, detaches. So, this is painful. So, this is your abruptio placenta. Okay, very good. Next, 120. Primigravida Belen, 30 weeks pregnant, is admitted for management of severe preeclampsia. Among Belen's treatment is intravenous magnesium sulfate. Okay, here you have your medication again, your Magso, your magnesium sulfate. Which of the following assessment findings would alert the nurse to suspect hypermagnesemia or your hypertoxicity or your toxicity of the medication called magnesium sulfate? A. Decrease deep tendon reflexes. B. Cool skin temperature. C. Rapid pulse rate. Or D. Your tingling in toes. What is your answer? Let me see your answer. What is that? How will you identify or how will you know if there is already magnesium sulfate toxicity? So all of you answered letter A. Okay, very good. So the answer is there is a decrease in deep tendon reflex. It should not be negative, it should be positive. So if you say decreasing, so that means your the deep tendon reflex is slowly fading. So that means there is already toxicity. Okay, there is toxicity. Okay, very good, everyone. Let's proceed. Number 121. When a woman who is confirmed to be 12 weeks gestation has sudden vaginal bleeding and uterine cramps. Okay, she would be suspected to be experiencing what? Okay, sudden vaginal bleeding and uterine cramps. Okay, sudden vaginal bleeding and uterine cramps. So, you suspect that the patient is experiencing what? A. Abortion. B. Hydatidiform bole. C. Placenta previa. Or D. Your abruptio placenta. So if you say, this is 12 weeks. Okay, 12 weeks gestation. Okay, 12 weeks. So, this is, it did not reach viable age. So, What do you think is this? Is this your abortion, hydatidiform mole, placenta previa, or abruptio placenta? So basically, if you say 12 weeks gestation, there is a sudden vaginal bleeding and uterine cramp, so that means this is your abortion. Okay, so that is letter A. Okay, very good, everyone. Okay, let's proceed. Number 122. Mrs. Max, at 10 weeks gestation, complains to the physician of slight vaginal bleeding and mild cramps. On examination, her physician determines that her cervix is closed. Okay, cervix is closed. The client is exhibiting signs of, okay, you have to identify. And which type of abortion is this? A, an evitable abortion. Evitable abortion, an incomplete, letter B, an incomplete abortion. Letter C, threatened abortion. Or D, a missed abortion. Okay, what do you think is the type of abortion thus Mrs. Max is experiencing? Okay, remember, this is your 10 weeks gestation. Then the patient is having slight vaginal bleeding, mild cramps, and there is your cervix is closed. That is your clue word, okay? So is that your evitable abortion, incomplete abortion, threatened abortion, or missed abortion? If you say evitable, okay? Evitable abortion, incomplete abortion, threatened abortion, and missed abortion, those are types of your abortions. Okay. So if you say missed abortion, that means the baby died inside the womb of the mother. Okay. So after the time that you had check the mother, you've noticed there is there is negative FHT, negative quickening, and there is the baby is small for gestational age. Once you try to look for the fundic height, okay? So, how about your threatened abortion? Your threatened abortion is there is no cervical opening, but there is bleeding. Okay, what is your incomplete abortion? Your incomplete abortion is some of the products of conception has passed out the vagina. Okay, and the other one is evitable abortion. Okay, so what is your answer? If you say cervix is closed, that is your threatened abortion. That means there is no negative cervical opening. Okay, there's no cervical opening. Okay, very good. Next, 123. At 16 weeks gestation, a pregnant client is admitted to the maternity unit to have a McDonald procedure. Okay, your McDonald procedure, your cerclage. When asked about the purpose of this procedure, the nurse answers correctly by explaining that this procedure is to what? A. Reinforce an incompetent cervix permanently. B. Evaluate cephalopelvic disproportion. C. Dilate the cervix. And D. Reinforce an incompetent cervix temporarily. Okay. So basically, it asks about if your McDonald procedure is permanent or temporary. Okay. So that means if you say McDonald's cerclage, that is your temporary. That's letter D. Reinforce an incompetent cervix temporarily. So if you say permanent, this is your Sherrod car. Okay, this is your Sherrod car. Okay, 124. A nursing student is preparing a prenatal class on the process of fetal circulation. The nursing instructor asks the student to specifically describe the process through the umbilical cord. The best response from the student is which of the following? Letter A. Okay, what is being asked in the question? Nursing student is preparing prenatal class on the process of fetal circulation. The nursing instructor asks the student specifically describe the process through the umbilical cord. Okay. The best response is A. The one artery carries freshly oxygenated blood and nutrient-rich blood back from the placenta to the fetus. Is your artery carries oxygenated blood? Okay. Remember that your arteries is your deoxygenated blood. Okay, that is your deoxygenated blood. Okay, this is your deoxygenated blood coming from fetus, okay, to mother. Okay, that is your deoxygenated blood. How about letter B? The two arteries The two arteries, okay, carry freshly oxygenated blood and nutrient back from the placenta to the fetus. So this is incorrect, okay? Because remember, arteries carries your deoxygenated blood. Okay, how about letter C? Your letter C states that, okay, letter C states that the two arteries in the umbilical veins, in the umbilical cord, carry blood that is high. The two arteries in the umbilical cord carry blood that is high in carbon dioxide and other waste products away from the fetus to the placenta. And your letter D states two veins in the umbilical cord carry blood that is high in carbon dioxide and other waste products away from the fetus or the placenta. So you're left with letter C and letter D. Okay, if you say veins, this is your oxygenated, not deoxygenated. Okay, but that is not two, that is only one vein. Okay, that is your AVA, two arteries and one vein. So your letter D is wrong. Okay, and so it does not carry carbon dioxide. It carries oxygenated, fresh oxygenated blood going to the baby. So the best answer is your letter C. Okay, the arteries in the umbilical cord carry blood that is high in carbon dioxide and the waste product of the baby from the fetus going to the placenta to the mother. Okay, so that is your letter C. Okay, very good, everyone. 125. A nurse is performing an assessment on a client who is at 38 weeks gestation and notes that the fetal heart rate is 174. Okay, 174 beats per minute. On the basis of this finding, okay, on the basis of this finding, the appropriate nursing action is to what? A. Notify the physician. B. Document the findings. C. Check the mother's heart rate. Or D. Tell the client that the fetal heart rate is normal. Okay. So the situation is the mother, okay, the client who is 38 weeks gestation, her FHT is 174 beats per minute. So the normal is only 120 to 160. So it goes beyond 160. So what will you do? If you will notice that the baby's heart rate is rising. So that means fetal distress. So what is your answer? What will you do as a nurse? Most of you answered letter A. Okay, some answered. Okay, so only A. So, so basically, what will you do if there is already fetal distress? This is already your fetal distress. Okay, this is your fetal distress. That means you have to notify the physician right away. So basically, this is due to your utero-placental insufficiency. Okay, utero-placental insufficiency. Okay, utero-placental insufficiency. So basically, you will notice your late decelerations. Okay, this is your late decelerations. Okay, so those are the instances that it might be the baby is having fetal distress. So do not forget to notify the physician right away. Okay. Next, number 126. A pregnant adolescent client asks the nurse about the menstrual cycle. Okay. The nurse describes the cycle and tells the adolescent that its normal duration is about how many days? Normal duration is about how many days? Okay. What is your answer? Normal duration is about how many days? Okay. What is your answer? Let me see your answer. Let me see your answer. B. B, how about the others? Okay, how about the others? Normal duration. Okay, B. Okay. How about the others? Okay. Remember this one. That your normal, okay? Normal menstrual cycle. Okay, normal menstrual cycle is how many days? This is 26 to 32 days. Okay, that is your 26 to 32 days. Your average is 28 days. Okay, that's the average. But if the women experience 26 to 32 days of menstruation, that is still normal. Okay, so the question is, normal duration is how many days? So basically that is is that letter B or letter C? What do you think? Is that letter B or letter C? If you will base it on your maternal and child health nursing book that states 26 and 32 days, that is your 30. Okay, that is your 30. That's the length, the total length of your menstrual cycle. Okay? How about Okay. How about number 127? A client in labor has been pushing effectively for 1 hour. Okay. So the client is in labor and she's pushing effectively for 1 hour. A nurse determines that the client's primarily physiological needs, this is your physiological needs at this time, is to what? A, ambulate. Are you allowed to let the laboring client who is already in the DR table to ambulate? B, rest between contractions. C, change positions frequently. Oh, what position? Trendelenburg position? Okay, or prone position after. Or letter D, consume oral foods and fluids because she is tired of pushing. So, she needs to eat. Okay, what do you think is the best answer during the time that your laboring client is pushing effectively? So basically, you have to let the patient rest between contractions. Okay? Let the client rest between contractions. Okay, 128. A client in labor is dilated 10 cm. Okay, at this point of the labor process, the nurse would plan to assess. Okay, the nurse would plan to assess the assess and document the fetal heart rate at least. Okay, at least. How many minutes do we need to assess and document the fetal heart rate, okay, of the patient? Okay, remember, if you will be monitoring fetal heart rate, that would always be the standard, which is your 15 minutes. Okay, that is every 15 minutes. Okay, very good. 129. A nurse is caring for a client in labor, and the nurse determines that the client's beginning second stage of labor when which of the following assessment is noted. Okay, if you say second stage of labor, this is your full cervical dilation to the delivery of the baby. So basically, you have to look for the dilation. So is that letter A, contractions are regular, B, membranes have ruptured, C, the cervix dilated completely, or D, the client begins to expel clear vaginal fluid. So that is your letter C. Okay, cervix dilated completely. Okay, very good. 130. Nurse Lisa is caring for a client in labor and prepare to auscultate the fetal heart rate by using the Doppler ultrasound. Okay, we're using Doppler ultrasound. The nurse accurately determines that the fetal heart sounds are heard by, okay, A, noting whether the heart rate is greater than 140 beats per minute. B, placing the diaphragm of the Doppler on the mother's abdomen. C, palpating the maternal radial pulse while listening to the fetal heart rate. And D, perform Lippos maneuver first to determine the location of the fetal heart rate. Okay, let's try to analyze this one. Nurse Lisa is caring for a client in labor. So you're using the Doppler to auscultate for the fetal heart rate. Now, the question is, the nurse accurately determines that the fetal heart sounds are heard by accurately determines the fetal heart sounds are heard by. Okay. How will you do what is the first thing or the first process that you have to do before placing your Doppler ultrasound? Okay. Because usually in the hospital, we only ask the mother of where does the nurse usually place the Doppler. Okay, so you're placing the Doppler anywhere in the abdomen. Okay, so that is not the right thing to do. You will not place a Doppler anywhere in the abdomen. Okay, and you will also um, need to make sure, okay, to make sure that you are getting the right fetal heart rate. Because if you will just place it anywhere in the abdomen, it might be you might get the heart rate of the mother. Okay? So, what will you do first before doing your Doppler ultrasound and able for you to get the good sound and fetal heart rate of the baby? So, what will you do is to do your performing your Leopold's maneuver. Okay. And that is your umbilical grip. Okay. The second maneuver called as your umbilical grip. You will locate the fetal back, the plane of the back of the baby, because there you will get the you can auscultate the fetal heart rate of the baby. So you have to do your Leopold's maneuver first. That is the importance of your Leopold's maneuver. Okay, so that is letter D. Okay, next is 131. Nurse Hannah is providing instructions to a pregnant client with human immunodeficiency virus, your HIV infection, regarding care to the newborn infant following delivery. The client asked the nurse about the feeding options that are available. The best response by Nurse Hannah is A. You will need to bottle feed the newborn infant. Okay, B. You will need to feed a newborn infant by nasogastric tube feeding. C. You will be able to breastfeed 6 months, and then you will need to switch to the bottle feeding. And D. You will be able to breastfeed for 9 months, and you will need to switch for bottle feeding. So basically, if the patient is diagnosed as an HIV patient, okay? If your patient is HIV patient, the mother is HIV patient, one of the um one of the transmission is through body fluids, okay? Body fluids. So basically one of that is the breast milk. So basically if your patient is a HIV patient, so the mother is not allowed to breastfeed at all. Okay? So the mother is not allowed to breastfeed. So what we have to do is you will need to bottle feed the baby. Okay? No need to do NASO NGT feeding to the baby. You can do bottle feeding to the baby. So that is letter A. Okay, very good. Let's proceed to number 132. Okay, 132. A home care nurse visits a pregnant client who has a diagnosis of mild preeclampsia. Okay, this is your mild preeclampsia and is being monitored for gestational hypertension. Which assessment finding indicates a worsening, okay? Worsening of your preeclampsia, and they need to notify the physician, okay? Because if you say mild preeclampsia, this is under, if you say proteinuria found on your mild preeclampsia patient, this is your positive 1 or positive 2. Okay, that is your proteinuria. BP is 140 over 90. Okay, so those are under your mild preeclampsia. But the question is, which assessment findings indicates worsening? So you have, after assessing the patient with mild preeclampsia, you will identify that this signs, okay, that this signs indicates worsening of the complication of the um eclampsia. So, is that A, urinary output has increased? B, dependent edema has resolved? C, blood pressure reading is at the prenatal baseline? Or the client, letter D, the client complains of headache and blurred vision. What is your answer? That should be, if you say urinary output has increased, so basically if they're not stating any like exact output, so if the patient is under 350 ml per hour, that's fine. Dependent edema is resolved, so that's okay. That's normal. Blood pressure reading is at prenatal baseline. That's normal. So what is not normal is your letter D. The client complains of headache and blurring of vision. As we have discussed last time, that these are all the signs of your severe, okay, these are all the signs of your severe preeclampsia. Okay, these are all the signs of your severe preeclampsia. Okay, your headache, your blurring of vision, because your blurring of vision would later become as if the patient is having blurring of vision because there is a vasoconstrictions going to the eye. So that gives you the explanation wherein the patient is experiencing blurring of vision. So the answer is letter D. Okay, very good. 133. Fertile mucus is described as which of the following below? Fertile. Okay. Fertile mucus. Okay. Fertile mucus is described as which of the following below? Is that sticky and cloudy, slippery and cloudy, flaky and stretchy, or clear and stretchy? What is your answer? That is your letter D. That is clear and stretchy. Okay. Next, number 134. Known as the male pelvis. Okay. Which among the choices given is for male pelvis? A. Gynecoid. B. Android. C. Platypeloid. Or D. Anthropoid. What is your answer? That is your, okay, that is your android. This is your male pelvis. Okay. How about your gynecoid? This is your, what is this? Your gynecoid. This is for, good for childbearing. Okay, this is good for childbearing. Okay. So your platypeloid, this is your flattened, okay? Flattened gynecoid. Okay, flattened gynecoid, this is your transverse oval. Transverse oval. Okay. And your android, this is your oval. Okay, that is your oval shape pelvis. Okay. Next, number 135. Most ideal pelvis for childbearing. That is your, very good. That is your gynecoid. Okay, that's your letter A. Let's go 136. What do you call the process wherein there is a union of ovum and sperm cells? What is that process? Okay, what is the process wherein you call it that there is a union of ovum and sperm cells? Okay, union of ovum and sperm cell. What is your answer in 136? Okay, most of you answered letter B. Okay, so that is correct. That is letter B, fertilization. So, nidation is also implantation. Okay, implantation. So the other term for your fertilization is fecundation. Okay, that is the other term for your fertilization, fecundation. And your nidation is the other term for implantation. Okay, next, 137. When performing Leopold's maneuver to a premigravida client, nurses is aware that to make her client more comfortable during the procedure, she should prepare the client for by asking her to what? Okay, before doing Leopold's maneuver, what you have to do with the patient? Okay, A, lie on her left side during the procedure. B, avoid eating before the examination. C, hyperventilate for a short time before the procedure. And D, empty her bladder before the procedure. What is your answer? What is your answer? Okay, most of you answered letter D. Very good. That is letter D. You have to empty her bladder before the procedure, okay? So that it would not be uncomfortable for the patient during the time of Leopold's maneuver as you perform the Leopold's maneuver. Okay, very good. 100, let's go. 138. Which of the following urinary symptoms does the pregnant women most frequently experience during the first trimester? First trimester, is that A, dysuria, B, frequency, C, incontinence, or D, burning? Okay, what is that frequently experienced during first trimester? That is what we call as your, okay, that is what we call as your, is that dysuria, frequency, incontinence, or burning? That is your frequency. That's letter B. Okay. Let's go 139. An immature egg releases and called as immature. This is called as your egg. Your egg. What is that? That is your that is your ovum. Okay, that's letter B. Okay, let's go 140. In which of the following areas would the nurse expect and observe your cloasma? Okay, what is your cloasma? This is your mask of pregnancy. Okay, this is your mask of pregnancy. Okay, now where will you usually observe your mass of pregnancy? Letter A, breast, areola, and nipples. B, chest, neck, arms, and legs. C, abdomen, breast, and thighs. Or D, your cheeks, your forehead, and your nose. What is your answer? So if you say it's mass of pregnancy, so it should be visible on the face. Okay? So those with answers breast and abdomen and chest are wrong. So that would be your letter D, your cheeks, your forehead, and your nose. So those are your, you will expect to observe cloasma in those areas of the face. Okay? Let's go 141. A pregnant patient states that she waddles when she walks. Okay, what is that? She waddles when she walks. The nurse explains, explanation is based on which of the following as the cause. Why does your pregnant woman waddles when she walks? Okay, A, the large size of the newborn. B, pressure on the pelvic bone, on the pelvic muscles. C, relaxation of the pelvic joints. Okay, or D, excessive weight gain. What is the reason why your pregnant patient waddles when she walks? Basically, guys, the reason is because of the hormone relaxin, which is most prominent in your pelvic joints. That's why this is your relaxation of the pelvic joints. Okay. So that is the reason why your pregnant women waddles when they walk. They look like a duck when they walk. Okay. So let's go 142. Placenta is the organ that provides exchange of nutrients and waste products between the mother and the fetus. This develops by when? A, first month, B, fifth month, C, third month, or D, seventh month. When is the full extent or the time that your placenta is fully developed? Okay, that is 12 weeks, right? That is 12 weeks, or converted to month, this is your third month. Okay, let's go 143. Cervical softening and uterine supple. Cervical softening, uterine supple are classified as which of the following? Is that your diagnostic signs, presumptive signs, probable signs, or your positive sign? What is that? Your Goodell sign and your cervical softening. What is that? That is your that is your under your probable signs. Okay, very good. You still remember your signs of pregnancies. Okay, 144. Which of the following would the nurse identify as your presumptive sign? Okay, we will look for the presumptive sign. Is that your Heger sign? Is that your B, nausea and vomiting? C, skin pigmentation changes? Or D, positive serum pregnancy? Okay, which among these options give you the best answer stating that these are the presumptive signs of pregnancy? Okay, if you say presumptive signs of pregnancy, this is your visible nausea and vomiting. Okay, that's your letter B. Okay, let's go 145. During which of the following would the focus of classes be mainly on physiologic changes, fetal development, sexuality during pregnancy, and nutrition? When is the best time? Okay, when is the best time that you will be giving all this informations or classes to a couple or pregnant women? Okay, when is the best time will you give educations to patients which is pregnant? Is that talking about your physiologic changes, your fetal development, your sexuality, during pregnancy and your nutrition. When is the best time? Is that letter D, third trimester, C, second trimester, or D, first trimester, or A, pregnant periods? If you say pregnant period, any of the trimesters, along with that range if the patient is still pregnant. So, when is the best time? So, the best time for you to give classes is your first trimester. Enable for the pregnant woman, enable for the couple to understand the fetal development, the changes that goes along with the pregnancy. Okay, and especially with the husband who needs more understanding, more patient because of the changes that happens to his wife. So that would basically be under your first trimester. Okay, let's go 146. In your 146, which of the following danger signs should be reported promptly during the antepartum period? What is your antepartum period? This is the period wherein this is the period of pregnancy. Okay, this is the period of pregnancy. Okay, so the period of pregnancy. So which danger sign shall we report promptly to the physician? Okay, A, constipation, B, breast tenderness, C, nasal stuffness, or D, your licking of amniotic fluid. What is your answer? This is your licking of amniotic fluid or your PROM. Okay, that is your PROM, your premature rupture of membranes. We have the gold standard, which is 24 hours. Okay, that is your 24 hours. My question is, if the patient is having prom and went to the ER and asked if she wants to know if what those fluid that goes out on the vaginal canal is just a urine or an amniotic fluid, what certain tests can we do on the ER to test if it's a leaking fluid or just a urine? Okay, what is the test that we use during in the ER? Okay, in the ER, we use the test to determine if the patient or the mother is having leaking of amniotic fluid. Okay, what is the test? Okay, that is your, what is that? What is that test? This is the test we will use as your nitrazine, okay, your nitrazine paper test. Okay, that is your nitrazine paper test. It will turn out blue if that is alkaline, and it will turn out orange or red if that is acidic. So that is how we will identify the leaking fluid. Okay. Okay, very good. 147. Okay, 147. Menarche occurs during the pubertal period. Which of the following occurs first in the development of female sex characteristics? Okay, which of them occur first in female sex characteristics? Is that your menarche? Next is your telarche. Next is growth of pubic hair. And the last one is vaginal secretions. So which among these four comes first in the time of developing your female sex characteristics? Your secondary sex characteristics. Let me see your answer. Okay, most of you answered letter B. How about the others? Okay, still letter B. So that is your thelarche. Okay, so thelarche, growing of, this is the growing of breast buds. Okay, this is the growing of breast buds. Yes, that is the correct answer. That is your thelarche, the grow of breast buds. Then you will have your growth of pubic hair, then your vaginal secretions, and the last one will be your menarche. Okay, very good, everyone. Okay, let's go number 148. Okay, in your 148, stating that which of the following is responsible for initiating menstrual cycle? Okay, which of this initiates your menstrual cycle? Which among these options give you the best answer? With the question states initiating the menstrual cycle. Letter A, ovaries. Letter B, APG, your anterior pituitary gland. C, hypothalamus, or D, uterus? Let me see your answer. Which one initiates? Okay. Most of you answered letter C. Okay. So, letter C is hypothalamus. So remember, the one that initiates your menstrual cycle is your hypothalamus. Okay. What makes a woman, okay, if the women experience abnormal menstrual cycle, basically the reason is your GnRH is insensitive to the trigger of hypothalamus. So that is the reason. So basically your hypothalamus initiates the menstrual cycle. So that is letter C. Okay, let's proceed. 149. The hormone that stimulates the ovaries to produce estrogen. Hormone stimulates the ovaries to produce estrogen is A, GnRH, B, LH, C, FSH, or D, your progesterone. Okay. What hormone in the ovaries? We're talking about in the ovaries that produces estrogen. Okay. Which hormone is that? Okay, let me see your answer. Okay. C, how about the others? Answered. Okay, how about the other? Okay, they answered still. Some answered letter B. Okay, B. Okay, some answered letter C. Okay, let's discuss this one. So you're confused with LH and FSH. Okay. So going back to your menstrual cycle, in the ovaries, you will notice there the egg cell, which is still immature. So it needs to be developed first. Okay. So the first one that will do the work, is your FSH. What is the work of your FSH? This develops the follicle. Okay, this develops the follicle. How does your FSH develops the follicle? Okay, so what will the FSH do from this egg cell? They will put barrier on that egg cell, which is what we call as your zona pellucida. Okay, that is your zona pellucida. And another barrier that looks like a crown is what we call as your corona radiata. Okay, corona radiata. And they are called as a whole as your Graafian follicle. Okay, Graafian follicle. So all of this barriers are put by your FSH in order to develop this egg cell inside. Okay, this egg cell inside. So how did they develop that one? How your FSH developed that one? Through your barriers, your zona pellucida, your corona radiata, the Graafian follicle, they are all secreting a lot of estrogen. They're giving a lot of estrogen so that that egg inside, that immature egg inside would be mature through the help of your estrogen, through the high surge of your estrogen. And that is basically because of your FSH. Okay? So the best answer is letter C. Your LH, this is for ovulation. Okay, so this is the reason why your egg cell will rupture and will go out to the ovary, going to the ampulla, giving the high surge of LH to sustain the ovulation. Okay, so that is your LH. So the answer for 149 is your FSH. Okay, let's go to the last number, which is your 150. Okay, 150. Which of the following characteristics of contractions would the nurse expect to find in a client experiencing labor? Okay. So how characteristics that you will notice to the clients who are characteristics of contractions that you will notice to the clients who are experiencing true labor. This is your true labor, okay? Letter A, occurring irregular intervals. If you say irregular intervals, this is under your false labor. Okay, this is under your false labor. Okay, letter B, staring mainly in the abdomen. Okay, staring mainly in the abdomen. Okay. Letter C, gradually increasing intervals. And letter D, increasing intensity with walking. So which one? Well, you know that there is true labor. If you say true labor, this is already continuous. Okay, this is already continuous. So basically, that is your gradually increasing intervals. Okay, the contractions are gradually increasing and until it will go to the transitional phase, from an active phase going to the transitional phase. Okay, so that is your 150, letter C. Okay, very good, everyone. So how was your score in OB? Okay, how was your score? Who got 100? Okay, who got 100? No one? No one got 100? No one got perfect? I no one got 150? Okay, how do you find the questions? Does it is it easy or hard? What do you think? Okay, what do you think, guys? How are you? How are you with the rationalization? Okay, so this time, since our we're done with our rationalization, okay, so we will go to our next topic, which is our pediatric nursing. Okay, we'll go with our pediatric nursing. So we're done talking about pregnant women. Okay, so let's talk about how we'll take care of the babies. Okay, so this is your maternal and child health nursing. Okay, so I know that in your pediatric nursing, there are some informations that are not really familiar because we're used of studying only OB. Okay, but we also need to know how to understand. Okay, how to take care, especially our newborn, because um, in midwifery you will be taking care of the newborn. Okay, you'll be taking care of the newborn, so you're experts with the newborn. In nurses, okay, in nursing, we take care from the baby until the baby will grow. Okay, so we have to know. And of course, in your pediatric nursing, we will also discuss about some complications, some diseases, some genetic diseases that is accompanied by the delivery of the baby, and some other complications of the babies that happen during the time of development of the baby inside the womb. So we'll be able to learn about those complications. Okay, so but of course we will start with the basic, and able for us to understand with the complications. We also need to understand how does the baby grow. Okay, what are the changes along with the baby. Okay, what are those developmental tasks that they will learn. Okay, so are you all ready to learn your pediatric nursing, everyone? Oh, so, some says it's hard, miss. Okay, it's hard. It's okay. They say that if it's just so easy for you, so that means you're not totally learning. No, if it's hard for you, that means you will strive harder to learn more, diba? To learn more of the subject. So it's okay. It's okay. What you have to do is to read. Okay, read your books. Okay, you have your soft copies, I guess, so you read that one. Okay, and able for you to really understand the concept of OB. Okay, that's okay. Okay, so let's start. You're all ready? Okay, ready, miss. Okay, let's go. And your pediatric nursing. Okay, so let's start with the definition of terms. Okay, let's define terms at first so that you will be able to know what are these terms in your pediatric nursing. Okay, we have here your growth. Okay, your growth is the physical change. Okay, remember this is your physical change Okay, this is your physical change. And quantitative increase in size. Okay, quantitative increase in size of the whole body or any of its parts. So that is your growth. Okay, like for example, you have there your birth weight. Okay, your birth weight. Okay, you have your birth weight. Okay, that is one of the examples of your growth. Okay, what other examples of your growth? You have there your height. Okay, your height. Okay, that is your height. Okay, you also have there, okay, those head circumference along with head circumference. Those are the changes, okay, that you will determine that these are your growth, these are your physical change. Okay, this is your physical change. Remember that your growth is quantitative. Okay, this is your quantitative because this is measured in numbers. Okay, these are all measured in numbers. Okay, so that is your growth. Okay, why is it very important for us? Okay, why is it very important for us to detect, okay, to detect or to know the growth of the baby? Because basically, okay, basically we have to know the growth of the baby in order for us to early detect, okay? In order for us to early detect problems. Okay? Problems. Is physically if that is an abnormal, okay? Abnormal growth pattern. Okay, you will know your abnormal growth pattern. Okay, why? Because all of this, okay, all of this signals something that is wrong with the growth of the baby. Okay, so we have to know the growth of the baby and able for us to early detect the problems. Early detection, early treatment. Okay? So because all of this, if you will detect, okay, earlier the problems, especially in the abnormal growth pattern, okay, you will be able to know if there is a problem in malnutrition, okay, along with if you say malnutrition, that is from the weight, right? Okay, of course your hormonal imbalance. Okay, hormonal imbalance. Okay, your hormonal imbalance. Okay, what others? This would also give you the the signs that the baby is having chronic, okay, chronic illness. Okay, the baby is having chronic illness. And the last one is your genetic syndrome. Okay, your genetic syndrome. That might be the baby is having this complication, this abnormal growth pattern because this is genetically made up. Okay, so that is one of the reason why we have to know the growth of the baby. So what do we need to do as nurses and midwife if we be able to know if um if we'll be able to know if there are certain complications, if there are certain abnormal of the growth pattern. So basically, as nurses and midwives, this is our responsibility. We have to do parental education. Okay, we have to educate the parents. Okay, so we teach the parents first as to their expected growth. Okay, expected growth patterns. So like for example, at this age, the baby should have a height of like this and like that. Okay, the mother should know because not all mothers are inclined in medical field. So as nurses, as midwives, we have to give them the education and the knowledge. Okay, this is very important. Your nutrition needs for each age. Okay. What are the nutrition that is needed in a certain age? Okay, like for example, toddler. especially your toddler, that they are all very picky eaters. Okay, so especially your toddlers, these are the most challenging part when you raise a kid, when you raise your children. This is the age that you have to modify a lot of like for example food, so that they just need to, they will eat. Okay, because they're very picky eaters on this age. Okay, what are the nutrition needed in your newborn? What are the nutrition needed as they school agers? Okay, so those are the educations that we need to also imply, we need to also share, we need to also give to the parents. Okay, and of course this one, the red flag to watch. Okay, to watch for, what is this? Okay, what is this red flag to watch for? Is this your boyfriend who is very red flag? Okay, so that's joke. Okay, so if you say red flag to watch for, you have to look for the patients or the baby. You have to tell the mother that in this age, the baby should learn how to walk. The baby should learn how to talk. The baby could speak syllables like this, like that. The baby could sit with support, could sit without support. So those are the developmental tasks that should be attained during at this kind of at this stage, at this age. Okay, so those are um the changes. Okay, so those are the changes that you have to be mindful for. Because if for example at the age of 3, the baby is, or the your child is not capable of speaking yet, so you know that there is wrong with the baby. Okay, so like for example this one. Okay. What is the growth? Okay, these are the patterns. Okay, the patterns. Okay, the patterns of growth by age. Okay, for example, the parents of the child should know that. Okay, in your infant, okay, infant which is 0 to 1 year. Okay, that is your 0 to 1 year. Remember that this is your fastest. Okay, this is the fastest growth. Okay. If you notice, you only observe the baby for as it was still newborn, and then once they reach 4 months, 5 months, they're already getting bigger. So that is the fastest growth. Remember, that is your infant stage or the phase. Okay. Weight, okay? Weight, the weight of the baby will times 3 by 12 months. Okay? It will times 3 by 12 months. Okay? And remember that the head will grow rapidly. So basically, your infant is the fastest growth. Okay? That is the fastest growth. Okay. Next is your toddler. Let's talk about your toddler. Okay, your toddler, this is the age 1 to 3 years. Okay, 3 years, that is your toddler. Okay, remember that your toddlers are very picky eaters. That's why this is the time for slower. Okay, slower weight gain. Okay, this is the time for your slower weight gain. Okay, and this is the time that the height of the baby of the toddler increases. Okay, height increases. Okay, and toddler. Okay, next is your preschool. Okay, your preschool. Your preschool, okay, your preschoolers, these are under 3 to 6 years old. So this is the time that they know how to write their names, okay, draw. So these are your preschoolers. So this is your steady growth, okay? This is just your steady growth, okay? That is your steady growth. And, okay, they become more adult like. Okay, they become more adult like, they talk like an adult. Okay, so they become more an adult like. So these are the changes, especially in the growth. Okay, according to this age group. As you go to your school age, okay, in your school age, remember in your school age, this is your 6 to 12 years, okay? This is your 6 to 12 years. This is your slower growth, okay? This is your slower growth, okay? That is your school age, okay? And you have there your adolescent, okay? You have there your adolescent. This is the time of your pubertal changes. Okay, you will experience your menarche, your thelarche, you're getting beautiful. You don't know how to do, you already know how to do skincare. Okay, so this is your 12 to 18 years. Okay, in your 12 to 18 years, this is your pubertal growth. Remember that in females, okay, in girls, you will have your growth spurt, right? Okay, you notice that um you notice that you are more you're growing. Your height is more accelerating than the boys. Okay, so basically because your age, you started your pubertal development by 9 to 12 years old. So basically girls experience first your growth spurt than boys. Okay, so that is your growth. Okay, so what are our roles as nurses? Okay, what are our roles as nurses in monitoring the growth of the baby? Okay, in monitoring the growth of the baby. Okay, so these are our nurses' roles. Okay, our nurses' role in monitoring growth. Okay, so you will also, that's why by knowing or by learning in this topic, you will appreciate why is it very important for us to determine the growth of the baby. Okay, first is we have to measure the weight. Okay, we measure the weight. Okay, and if you notice, as the baby is born, okay, as the baby is born, we do um cord care, diba? Cord care. So in your cord care, we measure the weight, okay? We also measure the height, okay? The height and the head circumference of the baby, right? So we measure there the weight, the height, and the head circumference of the baby. Okay, so that is one of our role as nurses. Second is we plot findings. Okay, we plot findings. Okay, we plot the findings and on age appropriate growth. Okay, on age appropriate growth. Okay, so for example, we plot the height so that we'll be able to know if there is an acceleration of height, if there is growth of the baby. And this one we also observe proper nutrition. Okay, observe proper nutrition. That's why as nurses, okay, as nurses and midwives, we educate the mother to breastfeed the baby in order for the mother to give good nutrition to the baby. So that is one of our role as nurses. Okay, so those are still under growth. Okay, going back to your growth, remember that your growth, this is a physical change. This is measured by numbers. That is why it is called quantitative. So one of the examples there is your birth weight and your height. So that is your growth. Now let's go to your next is your development. Okay, the next one is your development. Okay, if you say development, this involves the changes that marks an increase in functions, complexity, and progression of skills. Okay, basically, okay, if you say that this is the progression of skills, basically this includes the functions, functional abilities of the child. Okay, functional abilities. This including your okay emotions. Okay, emotional, including your cognitive. Okay, cognitive, especially your language. Okay, your language, and your motor and social skills. So these are under your development. Okay? So that is your development involves, okay, this involves changes in your, okay, increase in function and progression of skills. As you learn through, as you age, you know how to walk, how to talk, how to think, how to play. Okay, so those are your learned, okay, learned skills as you progress, as you age. Okay, so that's why along with the development is your functional abilities, okay, like how you walk, okay, um including your emotions, okay, how the child regulates emotions, cognitive, okay, the way they think, language, okay, your motor and your social skills. So those are your development. So um if your growth is measured quantitative, because that is measured in numbers, okay, your development your development is your qualitative. Okay, this is your qualitative changes. Okay, this is called your qualitative changes because these are your changes, okay, changes in abilities. Okay, these are your changes in abilities and function, okay, and function, okay, function over time. Okay, so these are your skills, okay, your skills that you have learned um a long time. Okay, so let's go to the areas of development. What are the areas? Okay, what are the areas? Okay, what are the areas of development? Okay, what are the areas that needs to be developed? Okay, first is you have there your motor. Okay, your motor. Okay. You also have there, so like your motor, you have there your crawling. Okay, your crawling. Okay, so those are the first development. You also have there your sitting. Okay, the sitting and your walking. Okay, those are under your motor. Okay, and you also have here your fine motor. Okay, what is your fine motor? This is your skill that you had acquired. You know how to, like for example, write. Okay, write your name. Okay. Okay, you also have there your language. Okay, this one, your language. Okay. If you say language, okay, in baby, okay, in 2 months, they will use babbling. Okay, as their first skills acquired, as they know how, as they will learn how to talk. Okay, and as they age they will know how to say words. Okay, saying words. And this one, they will also understand. Okay, they will also understand commands like kindly give me those umbrellas, kindly give me those hair combs. Okay, so they will understand commands. Okay, you sit, you stand up, you walk. So those are the under your language. Okay, let's go to your cognitive. Okay, your cognitive. What are the developments under your cognitive? You will have there your problem solving. Okay, your problem solving. Okay, this as you go along in time, okay, you will know how to solve problems, okay, on your own. You also have here your memory. Okay, under your cognitive is your memory. You also have there your recognizing objects. Okay, you're recognizing objects that you know that if you will see that object, you know this is the battlefield, the battle, the battle, the cell phone, everything that you see, will you already know, you already recognize it. So that is under your cognitive. And this one under your social and emotional. Okay, under your social and emotional, you will have there your playing. Okay, you're playing. Okay, you will have there your stranger anxiety. Okay, you will experience your stranger anxiety. Okay, you will if you notice people that are not familiar to you, okay, you will have your stranger anxiety. You will also have here your empathy. Okay, that is under your social and emotional. Okay, so how about this one? Okay, the last one. This is your adaptive. Okay, adaptive skills, adaptive, or this is your self-help. Okay, okay, this is your self-help. So, what are those adaptive skills? You have there your feeding yourself. Okay, feeding yourself. Okay, you also have here your toilet training. Okay, you know how to go to the toilet alone. And of course, your dressing. Okay, you know how to dress up alone. Okay, so those are the domain examples. Those are the domain examples with your development. Okay, basically in your motor, language, cognitive, social, and emotional adapt and your adaptive or your self-help. Now let's go to your principles of the principles of development. Okay, what are the principles of development? Okay, if you say principles of development, okay, these are the development, okay, happens in what specific area, okay, and how it extends. Okay, like for example, development first happen in your cephalocaudal. Okay, if you say cephalocaudal, this is your head to toe. Okay, what is the example of your cephalocaudal development? Like for example, the baby knows how to lift his head first before the baby could move his body. That is the first thing that the baby could do. That is your cephalocaudal. The baby could lift his head first, and that's the time that the baby could move his body. So the first thing is the head lagging. So the baby, if you notice your newborn, there is still head lagging of the baby. But as they age, as they become 2 months, there is no head lagging, and then that's the time they could move side to side. Okay, so that is your cephalocaudal. And for example, okay, the infants controls the head before their feet. Okay, so that is the first development. Okay, that is the first development that could the baby could acquire. Okay, so that is the first development. Second is your proximo-distal. Okay, proximo-distal. Okay, when you say proximo-distal, this is the center. Center to outward. Okay, center to outward. That is your proximo-distal. So for example, this is your trunk controls develops before your hands. Okay, so those are your proximo-distal. Okay, so and you also have there your sequential and predictable. Okay, this one. Your sequential sequence. Okay, sequential and predictable. Okay. Why is this sequential and predictable? Because you know what will happen next and next. Okay? That's why it is called sequential and predictable. What is the example of this? Example of this is your milestone. Okay, this is your milestones. For example, of your milestones is remember this one. The baby could the first thing that the baby could the baby could do is to sit first, and then next is to crawl. And then after crawling is to walk. So those are your sequential and predictable. We know that this is the pattern. After this, the baby could do this and could do that. So that is your sequential and predictable. And remember that your development is continuous. Okay, your development is continuous. Okay, so that is your under your development. Okay, your development is continuous. Okay, so, why is this important? Why is development important in your pediatric nursing? Okay, why is it very important that we have to know the development of the baby? Okay, the answer is because Okay? Early, this is for early identification of delays. Okay? This is your early identifications of delays. Okay? That's why we have to know, okay? We have to know that the pattern. We have to know the development of the baby if that is continuous. Okay. What will we do for if there is delay? Okay. Okay, we nurses screen. Okay, we screen for the developmental delays. Okay, we screen for the developmental delays or disorders. Okay, or disorders. So what do you think are these disorders that comes along with the delays of the development? Okay, what do you think are these disorders? Okay, anyone from the group, what do you think are these disorders if you will notice a delay of development? Okay, kaya pa.
Belum tahu
Kaya pa.
jawabannya.
Okay.
Apa nama disorder ya, Miss ya? Can you repeat the question again, Miss? What's the name of
Okay,
the disorder?
what are the disorders that goes along with
Ah,
the delays in development?
disorder apa
Okay.
aja yang kita sebut kalau misalnya kita apa namanya ada delay, ada keterlambatan pertumbuhan di anak itu. Disordernya namanya apa aja? Bisa diketik, ada yang berani jawab, langsung juga silahkan. Ada lagi selain Kak Siti?
City
Ayo,
answer dialect. Okay.
dyslexia,
How about the others?
speech
Speech
delay.
delay. Okay. Very good.
Ada lagi,
How
ada
about
lagi,
okay, speech
ada
delay.
lagi.
Okay, very good. Those are some
One
disorders.
answered
Okay,
ADHD, Miss.
okay, very good. ADHD. So you also have there your autism. Yes. Your ADHD. Yes. And your speech delay. Okay. So those are the things that, for an example, why it is very important that we have to know the development of the baby. Okay, so those are the reasons. Okay, and we also need to, what? As nurses, we have to do parental guidance. We have to guide the mothers and how to help this develop how to help the babies in this kind of delays. Okay, so that is your development. Those are under your development. Okay, so if you say development, this is your qualitative. Okay, qualitative, this measures your skills. Okay, this is your skills, your abilities, your functions over time. So that is your um development. Now let's go to your maturation. Okay, your maturation is your intrinsic process of development that are genetically and organically programmed. So this is genetically and organically programmed. So that is your maturation. Okay, so meaning that means this is your biological. Okay, this is biological. Okay, your biological process. Okay, this is a biological process. Okay, so basically, this goes along with your physical, emotional, mental characteristics. Okay, so those are your maturation. So if you say maturation, okay, these are your, okay, if you say maturation, this is equal to natural biological. Okay, remember, because genetically, this is genetically programmed. So biological readiness. Okay, readiness to acquire skills. Okay, to acquire skills. This is your maturations. Okay, so those are your under your maturations. Okay, it is also the inner timetable. Okay, inner timetable of development. Okay, controlled by genetics. Like in this age, okay, in this time, you will mature, you will it is because of it is controlled by genetics. Okay, this is genetically programmed to you. Okay, so let's go to your key characteristics, your characteristics of maturations. Let's go to your characteristics. Okay, characteristics of maturation. Okay, so what are the characteristics of your maturation? Okay, so you have there first your genetically driven. Okay, you're genetically driven. Okay, what are these genetically driven? If you say genetically driven, this is already your biological, okay, biological blueprint. Okay, what are the examples? Okay, examples are your puberty. Okay, your puberty. If you say genetically, as I've said, if you ask your mother what age did she experience menarche, basically and probably you will also experience menarche on the same age as your mom. Okay, so that is genetically and genetically programmed. Okay, you also have there your brain development. Okay, your brain development. Okay, so some child is intelligent because um, her parents are also intelligent as well. So those are genetically programmed, okay? Genetically driven. Okay, you also have here your automatic and sequential. This is along with your maturation, okay? This is along with your maturation, your automatic and sequential. Like for example, learning to sit before standing. So that is the same with your development, okay? And you also have there the other maturations that goes along with as you aged. Okay, so let's define the difference between growth, development, and maturation. Okay, what are the difference between growth and maturation in a simple way? Okay, if you say growth, okay, this is your growth. If you say growth, that is, this is your, what is this? Quantitative. Okay, this is your quantitative. Okay, quantitative. So basically, this is measured in, okay, measured in, okay, this is measured in size. Okay, size. Okay, like your height, like your weight. Okay, if you say development, okay, if you say development, excuse me. If you say development, what are those development? Those are your qualitative. Okay? Those are your qualitative. Okay? If you say qualitative, these are your acquired skills. Okay? Now, how about your maturation? Okay, your maturation. What is your maturation? If you say maturation, this is your potentials. Okay? Your potentials, okay, your genetic, okay, your genetic blueprint. Okay, so just like your puberty, your emotional control, how you control, how your reflex disappearance. So those are your um difference between your growth, development, and your maturations. Okay, so those are under your growth, development, and maturations. Okay, so any questions? Any questions? No questions? Okay, I have question. Okay, number one question is, a child begins to walk independently at 13 months. This is an example of, okay, walk. Is this an example of, what is this an example? If you say walk, okay, is that growth, development, maturation, or learned behavior? Okay, let me see your answer. Let me see your answer. Most of you answered B, development, B. Okay, very good. Very good. That is your letter. Okay, that is your letter B. That is your development. Why this development? If you say walk, this is under your motor, right? That is under your motor. So these are your skills. Okay, your acquired skills. Okay, so that is your development. Okay, very good. Next question. Next question. Which of the following tasks depends most heavily on maturation before it can occur? Okay. Which of the following tasks depends most heavily on maturation before it can occur? A. Counting numbers. B. Toilet training. C. Learning songs. Or D. Drawing shapes. Okay. What is your answer? Okay. What is your answer? Okay. Following task depends most heavily. Okay. Most heavily on maturation before it can occur. Okay. What is your answer? Okay, let me see your answers. Okay, let me see your answer. Let me see if you got it right. If you got it right. Okay. Okay, let me see your answers. You have there letter B. No other answer? Toilet training. Are you sure? Any answers? Okay. Okay, we'll see. Okay, in this question, which of the following heavily tasks depends most heavily on maturation before it can occur? Okay, so heavily, so that means this is the most vital, okay? The vital task that should be done first, okay? In maturation. Okay, so that is, what do you think is the answer? That is your, yes, this is your toilet training. Okay, so in that way, this is your natural maturation refers to the natural growth. Okay, the growth. So you have to know toilet training before you will know how to do all of the other options. Okay, next. Okay, next is basic division of childhood. Okay, what are the basic divisions of childhood, how it is being divided? Okay, how does your childhood is divided? Okay, what are the age bracket pertaining to this stage? Okay, now let's go to your neonate. If you say neonate, this is your first 28 days of life. Okay, this is your first 28 days of life. That is your neonate. If you say infant, this is 1 month. Okay, 1 month to 1 year old. Okay, this is your infant. Your 1 month to 1 year old. And your toddler, this is your 1 to 3 years old. Okay, this is your 1 to 3 years old. And you have there your preschoolers, those children who know how to write their names, simple as drawings. Okay, so those are your 3 to 5, okay, 3 to 5 years old. Okay, so those age and is under your preschoolers. Okay, how about your school age child? Your school age child, this is your 6 to 12, okay? 6 to 12 years old. This is your school age child. And you have there your adolescent, which is 13 to 21 years old. So how old are you? Are you under your adolescent? Are you still under adolescent? Okay. And your late adolescent will start with, okay, your late adolescent will start with 18. Okay, 18 going to 25. Okay, so above. So those are um your late adolescent. Okay, so that is your late adolescent. Okay, so these are the classifications and divisions of your childhood. So you have there a neonate, which is first 28 days of life. So that is your neonate. Okay. You also have their infant, that is your 1 month to 1 year old. Okay, that is your infant. You also have your toddler, which is 1 to 3 years old. And your preschoolers, this is your 3 to 5 years old. And your school age child is 6 to 12 years old. And your adolescent is 13 to 21 years old. And your late adolescent is 18 and above. Okay, so that is your age, okay? Age period along with the stages. Okay. Now, let's go to this question. Which of the following statements about pediatric growth is true? Okay, which Which of the following statements about pediatric growth is true? A. Growth is linear. Okay, growth is linear and constant throughout, okay, throughout life. B. Adolescent grows slower than preschoolers. C. Growth spurt occur. Okay, growth spurt occur in growth spurt occurs in infancy and adolescence. And D. Your weight quadruples by 1 year of age. Okay, what is your answer? Okay, what do you think is the answer? Okay, what is your answer? Let me see your answer. Okay, I will give you time to analyze the question first. Okay, I will give you enough time. Okay? Okay. So what do you think? Let me see if someone already answered. Most of you answered letter A. Some answered letter C. Okay, how about the others? How about the others? Okay, how about the others? Statement about pediatric growth. Okay, if you say pediatric growth, this is about quantitative. Okay, quantitative changes. So that is measured. Okay, so is that A, growth is linear and constant throughout life? B, adolescent grows slower than preschoolers? C, growth spurts occur in infancy and adolescence? And D, weight quadruples by 1 year of age. So what is your answer? Okay. Okay. The answer is that is your letter. Okay. That is your letter C. This is your letter C. Remember that the growth, okay? Remember that the growth occurs fast in infancy and your adolescence. Okay? Do not forget that one, that your growth spurt occurs most rapidly in infancy and adolescence. Okay. So since it is time, let's have our break for 15 minutes. Miss Nafta, Miss Nefta.
Okay. Let's have our break. Kita break dulu 15 menit ya. Hanya 15 menit. Kembali lagi semuanya terduduk di depan komputer di jam 10.15. Oke? Have your toilet break, snack break. Enjoy. 15 menit ya. Jangan lama-lama. Oke, yang sudah siap, tolong duduk ya. Yang sudah siap, tolong duduk. Kameranya dihidupkan. Kameranya dihidupkan. Yang sudah hadir, yang sudah di dalam Zoom, tolong ketik hadir kalau sudah siap. Sudah siap untuk mulai lagi. Yang di Aceh, di Jambi, Padang. Oke, kita akan mulai sebentar lagi. Jadi tolong teman-temannya tolong mulai dipanggil. Dipanggilin semuanya. Oke, baru lihat yang Aceh ya, yang baru banyak hadir. Yang di Padang, baru ke Igra. Ayo semuanya, kembali ke tempat duduk masing-masing. Biar kita bisa mulai cepat. Oke, Jambi. Yang duduknya satu komputer bertiga, tolong terpisah ya komputernya, jangan disatuin. Karena nanti waktu perhitungan kehadiran tuh susah, jadi nggak dihitung sebagai 3 orang, tapi dihitungnya sebagai 1. Oke, udah pada siap semuanya? Siap untuk mulai lagi? Siap, thumbs up kalau udah siap semuanya. Kameranya dihidupin kalau udah hadir. Jadi, thumbs up. Pada kemana ini? Thumbs up, thumbs up, thumbs up. Let's go. Oke, ready ya? Kita mulai ya. Oke, Miss Joanna, are you there? Yes.
Yes,
Oke.
yes.
Please
Okay, you're all
stand
ready.
now, I think. Yes.
How was your break, everyone? Okay, shall we continue? Okay. Okay, let's continue. Okay, continue with another question. Okay, question: at what age does the average child's triple their birth weight? Okay, at what age does the average child's triple their birth weight? Is that A, 6 months, B, 12 months, C, 16 months, and D, 24 months? Okay, what do you think? Okay, what do you think? What do you think? Triple their birth weight. Let me see your answer. Okay, let me see your answers. 12 months. 12 months. B, B. Okay, okay. Okay. So remember this one. Okay, remember this one that, okay, the birth weight, okay, the birth weight of the baby, okay, the birth weight of the baby, okay, so the birth weight of the baby will double. Okay, it will double around how many months? This is 5 to 6 months. Okay, the birth weight of the baby will double at 5 to 6 months of age. Now, when is the time that the birth weight of the baby will triple? Okay, it will triple at, okay, this is your 12 months. Okay, that is your 12 months. It will triple at 12 months or 1 year. So this is the key milestones in monitoring a child's growth and development. So you have to know that it will double on 5 to 6 months and it will triple on 12 to 6 months. So on 12 months. So this is your letter B. Okay, very good. Next question. Okay, this one. That question. Okay, which of the following best distinguishes maturation from development? Okay, which of the following distinguishes maturation from development? Okay. Okay, what do you think is the answer? Is that A, maturation is influenced by environment? B, maturity is voluntary? Okay. C, maturation follows genetic timeline, while development includes learned skills. So what is your answer? Is that A, B, or C? Okay, what is your answer? Okay, let me see your answer. Okay, most of you answered letter C. Okay, very good, everyone. Okay, the answer is letter C. That is your maturation follows genetic timeline because this is your genetic blueprint, while development includes your learned skills. Okay, like for example, if you say maturation, that is your that is your genetics. So this is your like you're walking. Okay, you're walking, you walk for example, compared to the other child in just 1 year, in 1 year of age, you already know how to walk, while the other child that is already 2 years old doesn't know how to walk yet, or 18 months. So that is the difference. Your teething, okay, your teething, okay, and your puberty. So those are your maturations. If you say development, those are your skills acquired, okay? Those are your skills acquired. Okay, very good, everyone. Okay, let's go to your theories of development. Who are the theories involved in studying about the development, okay? So we have here your Sigmund Freud. Okay, Sigmund Freud is your psychosexual theory. Okay, maybe in this theory you will also you can also discuss this one in psych. Okay, in psych, but we will also go along with these theories because this is the the theorist that has something to do with the development. Okay, so Sigmund Freud psychosexual theory, 1856 to 1939. He is an Austrian neurologist. So founder of psychoanalysis, okay? He's the founder of psychoanalysis and first introduced your personality development. So that is your Sigmund Freud's, okay? Psychosexual theory. Okay, what are the theories of Sigmund Freud? Okay, these are your psychosexual stages, psychosexual theories. Psychosexual development is a specific type of development, refers to developing instincts and sensual pleasure. Okay, those are with instincts. Okay, comes with instincts and the sensual pleasures. Okay, let's go found out. Infants, you have there your oral stage. If you say infant, their gratification is in oral stage. So the child explores the world using their mouth. So that is your oral. So sucking. Okay, those are their sucking, their um breastfeeding. Okay, the breastfeeding, those are the sensual pleasure of the infants. Okay, now let's go to your toddlers. Okay, your toddlers. Okay, your toddlers, this is the first time that you will this is your anal stage. This is the time that they will learn how to control their urination and defecation. This is also the best time for you to um inculcate, or you have to monitor them if they're already ready for toilet trainings. Okay, so your anal stage, the child learns to control urination and defecations. Okay, so that is under your toddler. Okay, and we also have there, okay, let's go first to your signs of readiness for toilet training. So what are those signs? Okay, what are those signs that you will know that the baby, okay, that the baby is ready for toilet training? Okay, how will you know if the baby is ready for toilet training? If the baby is already capable of doing this, if the baby is already capable of um going to the CR, if what is that, what are those signs? Okay, what are those signs that you will know that the baby is ready for toilet training? Okay, the first one is you have to know, you have to observe that that child, okay, that the child is able, okay, that the child is able to stay dry. Okay, that the child is able to stay dry for 2 hours. Okay. If the child is able to stay dry for 2 hours, that is one of the signs that you know that the child is ready for toilet training. Second, okay, second is child, okay, the child is waking up, okay, the child is waking up dry from a nap, dry from a nap. Okay, the child is waking up dry from a nap. So The child wakes up without wetting his pants. Okay, so that is the second sign that you will know that the child is ready for toilet training. Okay, we also have here the third one. The third is child. Okay, of course, the child is able. Okay, the child is able to sit, squat. Okay, sit, squat, and walk. Okay, if the child is able to sit, squat, and walk, that's the time. One of the things that you know that the child is ready for toilet training. Okay, also this one. Okay, the child also is able to, able to remove clothing. Okay, he already know how to remove his pants if he wants to, urinate. Okay, and the fifth one is the child recognizes. Okay, the child recognizes urge to defecate. He knows that he is about to defecate or urinate. Okay, that is one of the signs. And the sixth one is the child expresses. Okay, child expresses willingness. Okay, the child expresses willingness to please parents. Okay, why? Because when they please parents, they will do toilet training. They will do their toilet training in a perfect manner. Okay, because they want to impress their parents. Okay, and you also have there the last one. Okay, okay, the last one is child is able. Okay, the child is able to sit. Okay, the child is able to sit on the toilet. Okay, the child is able to sit on the toilet for 5 to 10 minutes. Okay, if the child could do that without fussing around, that's the time that you will know the child is ready for toilet training. So those are the signs that you will know that the child is ready for toilet trainings. Okay. Now, so that is for your anal stage. Okay, that is for your anal stage. Let's go to your preschool. Your preschool, this is your phallic. Okay, this is your phallic stage. Okay, so if you say phallic stage, the phallic stage, this is the time that the child learns sexual identity. Okay? The child learns sexual identity through awareness of their genital area. So they know that they
Sorry,
are
miss,
boy,
there
they are
is a
girl.
student that asked to be a bit slower. Just
May you okay, so sorry. Okay. Sorry guys. Okay. So in your preschool, you have there your phallic stage. Your phallic is when the child already learns their sexual identity through awareness of genitals. So if they already know that I am a boy, I am a girl, I'm having the penis, I'm having the vagina, so I am a girl, I have the penis, so I am a boy. So those are your phallic stage. Okay, those are your phallic stage. Now let's go to your school age. Okay, your school age, this is your latent. Okay, this is your latent phase. Okay, in your latent phase, the child's personality development appears to be non-active or dormant, depends on how they deal with the environment. Okay, so how they deal with the environment. So those are your latent phase. Okay, and the last one is your adolescent. Okay, your adolescent is your genital stage. Okay, if you say genital stage, adolescents develop sexual maturity and learns to establish satisfactory relationship with the opposite sex. So that's the time that they will have crush on opposite sex. Okay, so that's the time that they will look for green flags in men or green flags in women. Okay, so those are the changes. Those are your psychosexual theories. Okay, those are your psychosexual theories, which is studied by Sigmund Freud. Okay, so those are your psychosexual theories. Okay, so question. Okay, question according to Freud. Okay, according to Freud, which stage is characterized by pleasure derived from oral activities such as sucking and eating? A. Anal stage, B. Oral stage, C. Phallic stage, or D. Your latency stage? Okay, let me see your answer. Let me see your answer. Okay. Okay, most of you answered letter B, oral stage. Okay. Okay. So that is your that is your oral stage. Okay, if you say oral stage, this is the primary, the mouth. Okay, the mouth. Okay, the mouth is the primary source of pleasure. Okay, sensual pleasure. That's the mouth. That is your what's age group is this? This is your infant. Okay, this is your infant. Okay, so that is your infant. So activities in your oral stage are the sucking, the eating, okay, chewing, biting. Those are the sensual pleasures of your infants. Okay, so that is oral stage. Okay, how about this next question? Next question, during which stage does a child begin to identify with the same sex parent and become aware of genitals? Okay. What is that? Okay. What is that? During which stage does a child begins to identify with the same sex parent and become aware of genitals? Is that your latency, anal, phallic, or oral? Okay, what is your answer? Okay, most of you answered letter C, phallic. Okay. Okay. Phallic, phallic. Okay. So, you got it right, guys. That is your phallic. Okay. Let's talk about your phallic. What is your phallic? Your phallic, this is the time that the child, okay, the child is aware, okay, aware of their genitals. Okay. They're aware of their genitals. So they know their sexual differences. Okay. Like I am a girl, I am a boy. Okay. And this is the time of the time that they know that their parents is girl and boy, and this is the time of some attachments. Okay, attachments. Okay, this attachment is what we call as your, okay, first in boys we call it as your oedipus. What is your oedipus? Oedipus complex. Okay, what is your oedipus complex? Your oedipus complex, this is a strong, okay, strong attachment, okay, strong attachment of boys to their, okay, to their mother. Okay, that is the Oedipus complex. Their attachment to their mom is very strong. Okay, that makes them mother's ano mother's favorite. Okay, next is your Electra. Okay, you have your Electra complex. Okay. If you say Electra complex, this is the strong attachment. Okay, this is a strong attachment. Okay, of the of girls to their father. Okay, that is girl. Okay, so that is the Electra complex. So this is under your phallic phase. Okay, remember that one. Okay, let's go to the next theories. The next theory is about psychosocial theory. This is under Eric Erikson, stages of psychosocial theory. Okay, this is under Eric Erikson. So, basically, Eric Erikson is a former student of Sigmund Freud. So, stresses the importance of culture and society to the development of one's personality. So, it's the environment. He studied about the influence of the environment to a certain growth of the child. Okay, so that is your psychosocial theory. Okay, so let's go to your developmental task. Okay, under the theory of Eric Erickson's, your developmental tasks. Okay, so these are the tasks that you develop, okay, along with in the environment. Okay, so you have there the first one is trust versus mistrust. Okay, if you say trust versus mistrust, this is the age of 0 to 18 months. Okay, this is the age of 0 to 18 months. So remember that in your trust versus mistrust, trust is the foundation. Okay, trust is the foundation of all psychosocial tasks because this is the time that it will define the child if how will the child grow, how will the child will be able to develop trust to others. Okay, so that is the foundation of all psychosocial tasks. This is your trust versus mistrust, happens in 0 to 18 months. So what is the theme? Okay, what is the theme on this developmental task? The first is give and receive. Okay, this is your give and receive. Okay, because this is the trust. Okay, how is trust developed? Trust is developed, okay, how is trust developed? By first satisfying needs of an infant. Okay, satisfying needs of an infant, okay, on time. If for example, the infant is crying because the infant wants to breastfeed or battle feed. So if you satisfy them on time, that's the time that they will develop trust. Okay, so that is how trust is being developed. The second one is care must be consistent. Okay, care must be consistent. Okay, consistent and adequate. So that means you are giving a lot of care to the infant, giving your enough time, giving an adequate time to the infant. So that would also develop their trust. Okay. And you will also add security. How will you add security? How will you add security to your infants? Like example of that is your hugs, okay? Your hugs, your kisses, okay? Your kisses, your touch, okay? Your touch, your eye to eye contact, okay? Your eye to eye contact, okay? And those soft music, those are instances that the infant could feel that she is loved, okay? So that is the time that you will develop the trust, okay? Trust. If these are not being met, okay? If these are not being met or not being given to the infant, this will result to mistrust. Okay, so if the child has that mistrust, it will grow doubting people. Okay, they will have um, enough time. They need enough time to trust people like that. So those are the consequences that might happen if you will not develop the trust in the infants. Okay, so this is your trust versus mistrust. The second one is your autonomy versus shame and doubt. Okay, your autonomy versus shame and doubt. The age here is your 18 months, okay? You're 18 months to 3 years old, okay? Or 1 year to 3. This is your autonomy versus shame and doubt, okay? So if you say autonomy versus shame and doubt, these are your 18 months to 3 years old. What is the theme? Okay, the theme is, okay, the focus is independence. Okay, the focus is independence and self governance. Okay, self governance. Okay, self government. Okay, that is your theme or the focus of this. Why? Because your toddlers, okay, this is your toddlers. Your toddlers are those child who always want to do things on their own. Okay, like for example, they already know how to choose their what clothes to wear on a specific day. On this day, I want to wear that. I want to wear that. Okay, and they want to decide more for themselves. So those are your autonomies. Okay, they want to decide for themselves, they want to do things on their own, like dressing up. Okay, so those are the autonomies. Those are independence. They want to be independent. Okay, um they want to look like an adult. Okay, so those are your toddlers. Okay, so what will you do in your autonomy versus shame and doubt in your toddler? So what you have to do is give opportunity. Okay, give opportunity for decision making. Okay, give opportunity to this for decision making. Okay, for example, what do you want to eat today? Okay, this one or this one, so you let them decide. Okay, so those will add their autonomy, their independence. Okay, and offer choices. Okay, like offer choices. Okay, offer choices. And the next one is encourage. Okay, encourage the child. Okay, encourage the child to make decisions. Okay, encourage the child to make decision rather than judge. Okay, rather than judge. Okay, so you let them decide. Do not try to tell them not to do this, not to do that, because that would lead to shame and doubt. They might think that, okay, I will not be doing this because I might be hurting my mom. This is not good. I think this is not good. So you let them decide. Okay, you let them decide for themselves. You let them decide, especially in the small things, only in the small things that you think they could. Okay, because that would really help them to have this autonomy. Okay, because if this is not met, okay, if this is not met, the independence and self-governance is not met, it will lead to shame and doubt. Doubt. Okay, those children who would like, for example, you have a friend. Okay, you have a friend, and then you want to go outside, you want to eat outside you don't know, in some restaurants or what, and you ask your friend, where are we going? And then your friend will tell you, it's up to you. Okay, it's up to you. So those are one of the example of your friend who develop shame and doubt. Okay, your friend who doesn't want to decide for herself, like I still want, I will ask my friend if she is okay with that, like that. So those are some instances if these things are not being met. Okay, so you also have here your parents has a moral. Okay, parents has a moral obligations. Okay, friends has a moral obligations to set limits. Okay. Okay. This is you have to set limits. Not all decisions are being given to the child. Okay. So if that's so, okay, you will left empty-handed, especially if you will go outside malling. If you will let your child decide, okay, that's you will really go home without any money at all. Okay. So that is the autonomy versus shame and doubt. So you have to you have to let the child decide. Okay, especially in dressing up, and the food, the preferred food that she wants to eat. Okay, so those are your autonomy versus shame and doubt. So if this is not met, this will lead to your shame and doubt. Okay, next is your initiative versus guilt. Okay. Initiative versus guilt. This is your 4 to 6 years old. Okay. This is your 4 to 6 years old, your preschoolers, or 3 to 6 years old. Those are your preschoolers. Okay. Your initiative versus guilt, your preschoolers. What is the theme? Um, what is the focus of this initiative versus guilt? The theme is, okay, the theme is your Okay, the theme is learns how. okay, learns how to do basic things. Okay, she knows how to do basic things. Okay. For example, what you have to do for the child to have an initiative, give opportunity, okay? Give opportunity, okay? Exploring, okay? Exploring new places. Okay, exploring new places and events. Okay. So these are one of the things that could help the child to have that initiative, okay? And this is the time for your like going to amusement parks, okay? Your amusement parks. You will go to the zoos, okay? So this is the best time that you will um try to let your child, okay, explore, okay? Time for amusement, okay? Amusement parks and zoos, okay? Okay, so by then they will learn a lot of things in the environment, okay? So what are the activities, okay? Activities that we usually give to this child, to this preschoolers. Their activities is their modeling clay, okay? Their clay and finger painting, okay? And finger painting, okay? This is their activities. They love to do like finger painting, modeling clay, because this is the time that they able to enhance their creativity, okay? This enhances their creativity and imagination. Okay, this is the time that they enhances their creativity and imagination, and of course, and facilitates your fine motor development. Why? Because this is the time that they are going to their preschools. Okay, so they are already teach how to write, how to draw. Okay, so this is your um age 4 to 6 years old. You're preschooler. So this is your initiative versus guilt. So if these things are not met, so the child will not be able to have this creativity. Instead, they will not do that because they think they might get fail, okay, of doing that. So that would lead to guilt. Okay. Next is your industry versus inferiority. Okay, your industry versus inferiority, this is your school age, okay? This is your school age. So what is the age bracket in your industry versus inferiority? This is your 7 to 12 years old. Okay, this is your 7 to 12 years old. So what is the focus in your industry versus inferiority? This is they learn, okay? Learns how to do things well. Okay. So they learn how to do things well. Okay. So how will be able to um help them to do these things well? So what you have to do is give, okay, give appropriate short assignments, okay, give appropriate short assignments and projects, okay. So this is the time that the child is very competitive. Okay, they're very competitive. They really want to do their assignments. Okay, or else they will get a failing grade. Okay, so this is the time that they're very focused on doing the school works. Okay, so if they will, for example, they will have an unfinished project. If they will not finish any of the project given by the teachers, they will develop inferiority. Okay? So they will feel like they're unfinished, okay? Unfinished project will develop inferiority. Like for example, they will feel, why is my classmate had already finished her project while me I am still doing it right now. Okay, so they will feel inferior to the others because they maybe they lack of this, like they want also to compete because they're very competitive in this age. Okay, this is your school age. Okay, next, your industry versus inferiority is your identity versus role confusions. Okay, your identity versus role confusion, the age is 12 to 18 or 20 years old. Okay, this is your identity versus role confusion. 12 to 18 or 20 years old. So this is the time, okay? This is the time that learns, this is the focus, learns who he is, okay? Or what kind, okay? What kind of person, okay? What kind of person he will become. Okay. He learns who he is or what kind of person who he will become. Okay, and this is the time that they will adjust. Okay, adjust to new body image because of your, what is that, because of your puberty. Okay, they will adjust to new image because of puberty, because they're already increasing in height, diba? Their appearance is all different from before. They have their telarc. Okay, so they will, for girls, they're very prim and proper already. Okay, and this is the time also that they will seek emancipation. Okay, what is emancipation? This is your freedom. Okay, freedom from parents. This is the time that they always want to have sleepover, okay, to their classmates' house. Oh, sleepover. So this is the very crucial age, okay, very crucial age, because you really have to give guidance to them, because this is the time that they're still confused, okay, of who they will become, what are they, okay, because maybe because of the environment as well. So this is your identity versus role confusion. So if the child already learns that he who he is and what he will want to become, like for example, in this time, 12 years old to 18 years old, I want to take up nursing, I want to take up midwifery, I want to become a nurse, I want to become a midwife, I want to become a doctor. So that is your identity. That is the identity you want to have, okay, in the near future. Okay, so that is how you acquire your identity. But in this age, you're still confused. Okay, you're still confused of what to take up, what to take up in college, what to do in life. You're still under your role confusion. And this is where the guidance of the parents is very important. Okay? That is your identity versus role confusion. Okay. Now let's go to the next. Your next is your intimacy versus isolation. So your intimacy versus isolation, this is 18. Okay? This is 18 to 25 or 30 years. Okay, 30 years old. Okay. So, if you say intimacy versus isolation, the focus here is their career. Okay, this is your career focus. And this is also looking for a lifetime partner. Okay. This is their focus. Their career focus and looking for a lifetime partner. So you have to do both. Okay? You have to do both. Like in that age, you have to focus on your career, as well as you also have to look for a lifetime partner. Okay? Should not be the reason why you will say, I don't have partner because I still need to focus on my career. Okay. So actually, you can do both. Okay. You can do both. But, okay, you have to pray for it. You still need to pray for it. Kasi, this is one of the crucial stage as well, especially if you will be looking for a lifetime partner. So if this focus is not developed, or if this focus is not attained, you will left with isolation. So you don't want that to happen, right? So you have to look for a lifetime partner and a good career. Okay, so that is your intimacy. Okay, because for sure you are already in this age, 18 to 25, I guess. Okay. So, next is your generativity versus stagnation. Okay. This is your 30 to 45 years old. These are the people um, who wants to do a living, okay? Or who really wants to have a good career. You have to have a good focus on the career, okay? Or if they're not having a good career, no, if they're not employed, that will lead them to the stagnation, okay? And the last one is your ego integrity versus despair, okay? Ego integrity versus despair. What is this? This is your 45 years old and above. It should be ego integrity. If you are in a correct pattern, like in the first, as I've said, the very crucial part is your identity versus role confusion. Okay, that is the time of your teenagers. Okay, if you are guided and if you already know that this is my identity, I want to become a nurse. I want to I want to I want to have a good career. So that is going to your intimacy versus isolation. You will have a career focus, a good focus in your career, and that's the time that you have a good generating income. So that would not let you to stagnation, and you will also have your ego integrity. That would give you your ego integrity that I did this. I had spent my time um, working my career, and I am really good with this. If that is not attained, that would lead to despair. That your despair is your what if. What if in my age, in my 30, when I was still in 30, what I should have done this, I should have do this. Those will lead to despair. So these are the developmental tasks that you have to know according to Eric Erickson. These are all environmental. Okay, so this is your from your okay. Let's go back to your trust versus mistrust. Okay, trust versus mistrust. This is your infant, and this is your the foundation is your trust. Okay, it should be trust, so that is developed through giving the needs of the baby. Second is your autonomy versus shame and doubt. So the theme here is your independence and self-governance. So allow the child to have to decide. Okay, give opportunity to decide for the child, so that they may not experience shame and doubt. And you have there your initiative versus guilt. Okay, the focus is learn how to do basic things. Okay, so this is the time for their creativity and imagination. Okay, you will give them like the painting. Okay, this is the time of their enhancement of their fine motor development. Okay, you also have here industry versus inferiority. Okay, your industry versus inferiority learns how to do things well. This is the competitive type of you. Competitive child that who wants to really do things well. Okay, like for example, doing assignments and projects on time. Okay, if they will not if they experience not with unfinished projects, unfinished assignments, that will lead them to their inferiority. And you have here the very crucial, this is your identity versus role confusion. Okay, the age is 12 to 18 or 20 years. Learns who he is, okay, or what kind of person he will become. Okay, he knows what he wants, what what future he wants. Okay, so that is your identity. If not, that would lead to role confusion. Okay? And you have there intimacy versus isolation. This is your career focus. Looking for a lifetime partner is their focus. So this is your intimacy. If not met, this will lead to your isolation. Okay? And you have here your generativity versus stagnation, which is 30 to 45 years old. Okay, and your ego integrity versus despair, which is your 45 years old and above. Okay, so that is your developmental task under Eric Erickson's. Okay. Question. Do you have question? Okay. If you don't have, then let's answer this question. Okay, let's answer this question. What is the major developmental task of a toddler 1 to 3 years according to Eric Erickson? Okay. Major developmental task of a toddler. Okay, major developmental task of a toddler, 1 to 3 years, according to Eric Erickson. A. Trust versus mistrust. B. Initiative versus guilt. C. Autonomy versus shame and doubt. And D. Industry versus inferiority. Let me see your answer. Okay, let me see your answer. Okay, letter C. Most of you answered letter C. Okay, letter C. Okay, so that is your autonomy versus shame and doubt. This is your independence and self-governance. Okay, you have to give them um, opportunity to decide. Okay, to decide for themselves and offer choices. Okay, this is the time that you will offer choices. So that is your letter D, autonomy versus shame and doubt. Okay, next question. According to Erickson, which developmental task is important for an infant birth to 1 year? A. Learning to feed themselves. B. Developing trust in caregivers. Okay. C. Learning to say no. And D. Developing gender identity. Okay. What is your answer? What is your answer? Okay. Okay. That's letter. Okay. That's letter. Okay. So for your infant, okay, for your infant, so according to the developmental task of Eric Erickson, okay, that is your trust versus mistrust. Okay, this is your trust versus mistrust. So this is the time that you have to develop the trust. Okay, so that is letter B, developing trust and caregivers. Okay, next question. Okay, next question. A 5-year-old child enjoys playing pretend games and asks a lot of questions. Which developmental task is being displayed? Okay. A. Autonomy. B. Initiative. C. Industry. Or D. Identity. Okay. 5-year-old child enjoys playing pretend games and asks a lot of questions. Okay. This is your preschoolers. Okay. Preschoolers. So what do you think is the answer? Okay, that is, most of you answered letter B. How about the others? Okay, so the answer here is the answer here is your initiative. Why? Because this is the time that they shown, okay, initiative is shown in children in the age 5 years old. This is your preschoolers, okay? They enjoy to pretend games, okay? And make believe like your their imaginations, okay, and they want to explore and they ask a lot of questions. So this is your initiative. Okay, so initiative, so that is your 5-year-old, your preschooler. Okay, let's go to your stages. Okay, your stages of growth and development. Okay, let's go to your stages of growth and development. What are the stages of growth and development? Let's start with your infancy. Okay, let's start with your infancy. Okay, in your infancy period, what are the infants' fear? Okay, what are their fear? Okay, in your infancy period, their fear is your stranger anxiety. Okay, this is your stranger anxiety. Okay, like if they see not familiar faces, okay, if they see not familiar faces, that's the time that they will be able to um they will get like they will distant from that person. Okay, they will distant from that person. They don't want to get held by that person. So that is your stranger anxiety. When is the time that they will also recognize as strangers? Okay, in your infancy they recognize as strangers at 6 months. Okay, recognizes strangers. Okay, recognizes strangers. Okay. But the peak of their stranger anxiety is in your 8 months. Okay, this is your peak of stranger anxiety. Okay, this is your peak of stranger anxiety. Okay, that is your 6 months. They already recognize strangers. In your 8 months, this is the peak of their stranger anxiety. Okay, now what is the play? Okay, what is the play um your infant? Okay, this is your solitary. Okay, solitary play. What is solitary play? They play alone. Okay, what are the toys? Their toys are, this is your mobile. Okay, this is your mobile. Okay, your rattles. Okay, your rattles. Your musical toys. Okay, your musical toys. They have their musical toys. Okay, musical toys. Okay, musical toys, and they also have their crib. Okay, they will play on their crib. Okay, and remember this one, that in your infancy, this is a rapid, okay, rapid growth and development. Okay, this is a rapid growth and development. Okay, and this is from, okay, this is from birth, okay, birth until 1 year. Okay, that is your infancy period. So remember, in your infancy period, you have their fear is their stranger anxieties. So the peak, the first time that they recognize as strangers is in their 6 months of age. Okay, they recognize as strangers, and their 8 months is the peak of their stranger anxiety. Okay, and their play is solitary. So they play alone. Okay, they play alone. And the toys is mobiles, rattles, music toys in their cribs. Okay, so those are their toys. And they have, remember this one, always remember this one, that in your infancy period, this is the rapid growth and development. Okay, this is the rapid growth and development. This is from birth until 1 year. That is your infancy. Okay. Next to your infancy is your toddler. Okay, your toddler. What do you think is the fear of your toddler? Same with your infancy. In your infancy, this is your separation anxiety. Okay, your separation anxiety. Okay, that's why they don't want to get separated by their um stranger anxiety is your infancy. In your toddler, they have their anxieties, which is separation anxiety. They don't want to get separated by their parents. Okay? So, what are their play? Their play is parallel. Okay, parallel. So, what do you mean by parallel? Two of them are playing. Both, they want to have friends. Okay, they play with others, but they don't cooperate with each other. Okay, they just play the same toys, but they will not cooperate with each other. Okay, so their toys are push and pull. Okay, push and pull toys. These are their toys, push and pull toys. Those cart. Okay, so those are your um toys. Okay, and remember, the age of your toddler is 1 to 3. Okay, 1 to 3 years old. Okay, this is your 1 to 3 years old. And this is also characterized with, remember, characterized with, characterized by alternating, okay? Alternating rapid and slow, okay? Alternating rapid and slow rate of growth, because they are very picky eaters, okay? So these are your toddlers, who is characterized by alternating rapid and slow rate of growth and development. And you will also notice in your toddler, you will also notice their pot belly. Okay, looks so cute. Pot belly, okay? What is the reason of their pot belly? Because their abdomen is still underdeveloped. Okay, so that's why they have pot belly. Okay. And they also ask questions, okay? Ask questions. They keep on asking questions, okay? Ask questions constantly, okay? Ask questions constantly up to 400 a day. Okay, so how will you entertain those questions? Okay, 400 questions in a day. Okay, that's why one of your interventions in toddler is to make them sleep so that they will not ask a lot of questions, right? Okay. And remember that your toddler has a consistent, okay? Consistent bedtime routine. Okay. They have their consistent bedtime routine. Like they have their nap at 1, okay? They have their sleep at 6, 7. Okay. So that is for your toddler. Okay, remember your toddler, they have their separation anxiety and their play is parallel. Okay, and your toys is push and pull toys because it's the time that they're also learning how to walk. Okay, and characterized by alternating rapid and slow rate of growth and development. Then you will also notice their pot bellies. Okay, and they ask question constantly up to 400 a day, and they are consistent in bedtime routine. So if they sleep on an at 1 a.m. for a nap and 1 p.m. for a nap, and then 8 p.m. in the evening, so that is their time. That is their routine. Okay? So that is for your toddler. Next to that is your preschoolers. Okay, your preschoolers. Okay, your preschoolers, what is their fear? Okay, what is the fear of preschoolers? Their fear is mutilation, okay? Mutilation and castration. Okay. Okay. They're afraid with the wounds. Okay. They're afraid with the cuts. Okay. So those are their fear. Okay. So this is their your preschooler period. Okay. What is their play? Their play is already association. Okay. They go along with other playmates, and imitation. Okay, they imitation. Okay, they imitate their mom, they imitate their dad. Okay, because this is also the time of your Oedipus and Electra complex. Okay, remember, this is your preschool period. That's why they are one of their play is association and imitation. Okay, what are their toys? Their toys are, okay, a simple puzzle. Okay, they want simple puzzle. Okay, okay, they also want dolls. Okay, dolls and coloring books. Okay, they like coloring books. Okay, that is one of the toys that your preschoolers wants to have. Okay, age is, this is your 3 to 5 or 3 to 6. Okay, 3 to 6 years old. Okay, this is your preschooler. So this is the time of your Oedipus, okay? Oedipus and Electra complex, okay? Oedipus and Electra complex. This is the time of your Oedipus and Electra complex. If you say Oedipus, this is a strong attachment of the son to mother, okay? If you say Electra, the strong attachment of the daughter, okay? Daughter to their father, okay? The mama's boy and the daddy's girl. Okay, so these are your preschool period. Their fear is mutilation, castrations, okay? Cuts, wounds, okay, those are their fears. Play is association and imitation. Toys is a simple puzzle, dolls, coloring books, and this is the age of 3 to 6 years old. And this is the time of your Oedipus and Electra complex. That's why one of their play is imitation. Okay? So that is under your preschool period. Next, your preschool period is your school age. Okay, let's go to your school age. Your school age, what is their fear? Okay, their fear is displacement from school. Okay, displacement from school. Okay. Because at this age, they are very competitive. So they want to do things right. Okay. So they want to be they don't want to be displaced from school. Okay. So that is their outlet. Okay. So that's why they will really do that, they will really do things right. Okay, so that is the fear of your school age. Okay, and you also have there your play. Their play is cooperative. Okay, cooperative, so they play with others. Okay, they play with others, they have their competitions. Okay, competition, so those are the play of your school age. You also have there, what are the toys that they want? Okay, they want this, your computer games. Okay, computer games, because they could play that one along with the other opponents. And table games. Okay, and table games. Okay, so most of competition games, those are the school age, those are the toys of the school age. And age is from 6 to, okay, age is 6 to 12. Okay, age 6 to 12 years old. Okay, this is your age. Okay. And remember that your school age is characterized, okay? Characterized by having, okay, a slow period. Okay? This is the slow period of growth and development. Okay? Growth and development. Okay, these are your school age. Okay? So characterized by having a slow period of growth and development. So this is under your school age. Okay. Next, your school age is your, this one, your adolescence. Okay, your adolescence. What is the fear of your adolescence? The fear of adolescence is displacement. Okay? Displacement, okay, from peers. Okay, displacement from peers or their friends. Okay, their friends. Okay, that's why on this age they always want to get along with their friends. They want to keep up with their friends. Okay, they're very hesitant to say no because they might lost a friend. Okay, so they always want to have a friend, they have to want a couple of friends. So this is their fear, displacement from peer and their friends. Okay, what is their play? Their play is athletic and sports. Okay, this is the time for athletic and sports. Okay, so they are sporties. Okay, they play badmintons, they play soccer. So these are their play. What are the toys? They love to have music. Okay, they love to have music and gadgets. Okay, iPhone 16 Pro Max. Oh, those are the toys that your adolescent wants. Okay, and remember that in your adolescence, you have there your accelerated, okay? Accelerated growth, okay? Accelerated growth and maturation. Okay, this is the time for accelerated growth and maturation because this is the time of the puberty. Okay, that's why this is your accelerated growth and maturation. This is the time that um you are influenced, okay? You are influenced with the hormones, okay? Influenced with, okay, with the hormonal changes, okay? You're influenced with the hormonal changes, so you will experience your growth spurt, okay? You will have your growth spurt, okay? And you have your um stellar, okay, for girls, stellar, and then for boys, voice changes, okay. So those are one of the examples of one of the hormonal changes, okay. So this is under your puberty, okay. This is your puberty, okay. So this is your adolescence, okay. So those are the um the stages, okay? Those are the stages of growth and development from your infancy period going down to your adolescence, okay? So those are under your stages of growth and development, okay? How you develop, okay? How what are the difference between going from infancy until you become an adolescent? Okay, so those are the changes under the stages of growth and development. Any question? Do you have questions? Okay, do you have
Ada yang mau
questions?
bertanya? Nggak ada pertanyaan?
Do you have questions
Clear?
before we proceed with the other topic? No, miss. Okay. How about the others? Clear, miss. Okay. Okay, so let's continue. So let's continue with the next topic. So the next topic would be your developmental milestone. Okay. Your developmental milestone is very important. Okay. This is very important, especially in the development of the newborns. Okay. Development of the newborns until 18 months. Okay. 18 months to 3 years. You have to know what are the development because as we have said, why we have to identify the development, early detection, because for us to know if there are delays, okay, in this age, in this months, should be the baby should know how to do this, the baby should know how to do that. So this is your developmental milestones, okay. So you have to be aware of what are the milestones in a certain age or months of the baby. Okay, let's go for your developmental milestones. Let's start with your bowel and bladder control. So if you say bowel and bladder control, you have there your bowel control, which is usually happens at 18 months. Okay, 18 months to 1.5 year. Okay, 1.5 years. Okay, so that is your bowel control. So in this age, 18 months to 1.5 year, the 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 child already knows how to control her bowel. Okay, so that is for your bowel control. Next is your daytime bladder control. Okay, your daytime bladder control, this is 2 years. Okay, at 2 years old, they will be able to already control their daytime bladder. Okay, like to urinate in day. Okay, so they already know how to control that one. While your nighttime is 3 years. Okay. So that is 3 years. Nighttime bladder control will happen in 3 years. Okay. So the first one that they will already acquire or know is your bowel control. Okay. That is from 1.5 years. Okay. And next is your daytime bladder control. And the next one is your nighttime bladder control. Okay. So that is your bowel and bladder control. Okay. Let's go first to your neonate. Okay, in your neonate. Okay, in your neonate, you have there. If you notice in your neonate, you will notice that they will have a complete head lag. They still don't know how to control their head. Okay, that is their complete head lag. Okay, and you have there largely reflects visual fixation for human face. Okay, and observe that they will have their hands fisted. Always hands fisted, okay? Thumbs in and hands fisted. So that is your neonate, okay? Hands fisted, thumbs in. Okay. And cries without tears. Okay. What is the reason why they cries without tears? Basically because that their lacrimal glands are not yet fully developed. Okay? So those are not just um a joke. Okay, they're really crying, but it's just they don't have tears because their lacrimal glands are not yet fully developed. So that is your neonate. Okay, so that is your neonate. Remember, in your neonate, you have your complete head lag, and this one, your hands fisted, thumbs in. Okay, and cries without tears. That is your neonate. Okay. Next to your neonate is your 1 month. Okay. What are the things that happens, okay, develops in your 1 month? Okay, what are their milestones? In your 1 month, their dance reflex will disappears. Okay, that is your dance reflex. It will disappear. Looks at mobiles. They look at they already know how to look at the mobiles, okay, in their cribs. And they follow midline. Okay, they follow midline. And they are also alert to sounds and regards face. So that is your 1 month. Okay. So that is your 1 month. Next, your 1 month is your 2 months. Okay. Here in your 2 months, there are a lot of changes. Okay. There are a lot of development under your 2 months. So in your 2 months, remember, as I've said, your development is cephalocaudal, right? Head to toe. So it is first the head that they will manage. The next is um their extremities. Okay, their body, and then their legs. Okay, and the feet. Okay, so those are the cephalocaudal. Okay, so first is holds heads up when in prone. So if they're in prone position, they know how to lift their heads. Okay, so from head lagging to holding their head up in prone position. Okay? So that is your 2 months. Okay? And this is the time that they will have their social smiles. So they know how to smile back at you. So they know how to they already cries with tears because their lacrimal glands are already developed, and they have their cooing sound. Okay? So remember, in 2 months, you have here your holds heads up in prone position, and their social smiles. Okay, their social smiles. And remember, the closure of their posterior fontanelle happens 2 to 3 months, or 18
Oh,
months, 12
bilis
to 18
ah.
months. Okay, that is the closure of posterior fontanelles. Okay, because 2 to 3 months, that is the earliest. Okay, first fontanelle, the posterior fontanelle will close at early 2 to 3 months, and your anterior fontanelle, okay, your anterior fontanelle, it closes at how many months? 12 to 18 months. That is for your anterior fontanelle. Okay, and this one, head log. Okay? Head log when pulled to sitting position. Okay, if you will try to let the baby sit in a sitting position, they will have the head log because they could only lift their head if they're in prone position. But if you will try to let them sit, okay, they will have the head lag again. Okay, so that is your 2 months. And they no longer clinches their feet. So from clinches of feet in your neonate, they no longer clinches their feet. Okay? And follows object past midline. And they already recognizes their parents. Okay? They know that this is their mom and this is their dad. So that is your 2 months. Okay, let's go to your 3 months. Okay, in your 3 months holds head and chest up when in prone position. So for example, for your 2 months, he can hold his head up in prone position but not his chest. Okay, but in 3 months, he can already hold his head up and his chest in prone position. This is your cephalocaudal. Okay? From head, then the body, and then the lower extremities. Okay? So that is your cephalocaudal. That is the subsequent. That is the sequential. Okay? So from head and then the chest when they're in the prone position. Okay? Holds hand open at rest. Okay? If you will if they will hold your hand. Okay, hand regard follows object past midline, and your grasp and tonic neck reflexes are fading. Okay, their tonic neck reflexes are fading. Okay, those are your tonic neck reflexes. Don't you worry, we will discuss your reflexes in maybe after this one. Okay, and reaches for familiar people or object because in 2 months they can already identify their mom and dad. This is my mom, this is my dad. Okay, so that is your 3 months, and they already know that the mother is about to feed them. Okay, so they anticipate feeding. Okay, so that is your 3 months. Okay, so remember, in your 3 months, you have there, they can hold head and chest up in prone position. Okay, that is your 3 months. Okay, and they reaches from familiar people or object. Okay, that is your 3 months. Okay, and that is for your 3 months. Let's go to your 4 months. Okay. In your 4 months, okay, from 2 months that they have, they from 1 month with head lagging to 2 months that they already can lift their head in prone position to 3 months that they can already lift their head and chest in prone position to fourth month that they could already control their head. Okay, completely. They can already control their head completely. Okay, turns from back, front to back. Okay, so they can turn from front to back. Okay, so this is the time that they are trying to turn in bed. Okay, and this is your laughs aloud and your bubbling sound. Okay, this is your they laugh aloud and your bubbling sound. Your Babinski reflex will disappear. Your funning J, that is your Babinski reflex. So that is in your 4 months. Okay, next to your 4 months is your 5 months. Okay, if you say 5 months, this is the time that they could really turn over, roll over. Okay, this is your roll over. They can roll over from both ways. Okay, this is the start of the time that they will, on the next month, they will have the eruption of teeth. So this is the time for your teething rings. Okay, teething rings. And this is the time that they could really grasp the rattles well. So handles rattle well. Okay, and this is the time that your moral reflex will disappear. What is your moral reflex or your startle reflex? This is for example, if you tap a loud sound, okay, tap a loud sound or bassinet that has a loud sound, okay, the baby will not shake, okay, anymore. So that is your a disappearance of moral reflex, okay, because your moral reflex is a reflex needed so that we will know if there is neurological disorders to the baby, okay. And you also have here in your 5 months enjoys looking around because they can already see clearly around. Okay, so that is your 5 months. Just remember this one, roll over. Okay, 5 months is your roll over. Okay, and your moral reflex will disappear at 5 to 6 months. Okay, so that is your 5 months. Let's go to your 6 months. Okay, your 6 months has a lot of development because this is the time that you can this is the time that they will have their eruption of teeth, okay, and some other changes. Okay, so in 6 months they reaches out in anticipation. Okay, they know if they know that they will be held. Okay, and this is, remember this one, sits with support. They can sit but they still need support. Okay, with support. They still need support, okay? And puts feet on the mouth, okay? Their feet, they want to put their feet on the mouth. Very flexible. They are very flexible, okay? And remember this one, that this is the eruption of first temporary teeth, the lower incisors, okay? The lower two central incisors. That is their first eruption of teeth. And they can already say vowel sounds like eh, okay, okay. Those are their vowel sounds in your 6 months, and they can use palmar grasp, and they can hold the bottle well, so they can feed their own, okay, with the bottle. And as I've said, this is the time that they already recognizes the strangers, okay. So if the faces are not familiar, Okay, they will not allow to be held by those unfamiliar faces around their house. Okay, so this is the time that they recognize strangers apart from seeing their mom and dad, okay, and their siblings at home. So if you are a stranger, if you are new to their house, so that would be they could already recognize that they are not that you're not part of the family. Okay, so this is your 6 months. Okay, let's go to your 7 months. Okay, in your 7 months, they can transfer objects from one hand to one hand, from here to the other, from here to the other. So this is your 7 months. Okay, and they like objects that are good size for transferring. Um those objects that are that they can, okay, that they can hold properly, those small, I guess, just smaller objects that they could transfer from one hand to other. Okay, that is your 7 months. Okay, and let's go to your 8 months. Okay, from your 6 months, that your 6 months sits with support. Okay, your 6 months needs sits with support. Your 8 months sits without support. They can sit without support anymore. Okay, so that is your 8 months, and this is the peak of stranger anxiety. From 6 months that they recognize as strangers, in 8 months they have the peak of stranger anxiety, that they don't really want to be with other people except to their mom and dad. Okay, that is your 8 months. Okay, 6 months, you have their sits with support. 8 months sits without support. 6 months recognizes strangers, and your 8 months the peak of stranger anxiety. Okay, and you have there the plantar reflex disappear. Their plantar reflex disappear from 6 to 8 months, and we have here your 9 months. Okay, your 9 months, this is the time that they know how to crawl. Okay, creeps and crawl. That's why they need a space for creeping and crawling. Okay, so this is your neat pincer grass reflex, and they know how to pick. Okay, pick objects and finger feeds. Okay, and they can say 2 syllables like mama and dada, mama and dada. So those are your 9 months. Remember, in your 9 months is your creeps and crawls and your pincer grass for 9 months. Okay. And next is your 10 months. Okay. Your 10 months, full self to stand. They already know how to stand. Okay. Understand the word no. Okay. If you say no, do not do that. No, don't go there. They already understand. Okay. Respond to name if you call them. Okay. If you call them, they respond. Okay. And peekaboo, pat the cakes, since they can clap. So that is the play that they want. More of the hands play. Okay. And your 11 months is this one. In your 11 months, cruising. They're cruising. So from one area, they will cross to the other area. Okay? They could stand but with assistance. Okay? They could stand but with assistance. Since in your 10 months, they could already pull themselves to stand, but they still need assistance, like standing in a furniture. Okay, some in the furniture, cruising in some other furnitures. Okay, like sofas. Okay, walking while holding to his crib. Okay, and one word then mama and dada. So they have already mama, dada, yaya. Okay, so those are their um for 11 months. Okay, in your 12 months, this is the time that they can stand alone. Okay, they're good in standing alone. Walk with assistance. They need to still have assistance in walking, and drinks from cup. Okay, so they don't need a bottle. Um, they don't need to have bottle feeding. They could already drink from a cup. Cooperates in dressing. Okay, if you say raise your hand. Okay, and says 2 words other than mama and dada. Okay, so So mama, dada, yaya, tata, those are the words that the 12 months could utter. Pots and pans, pool toys, and nursery rhymes, okay, cocomelon, those are the um, toys that the 12 months, okay, loves, okay, imitates actions, comes when cold, and follows one-step command and gesture, and uses your pincer grasp, and they can throw objects. So be careful. So those are your 12 months. Okay, those are the changes. Those are the development in your development in those are developmental milestones that will happen during the time of from 1 year old to 12 months infancy period. Okay, in your infancy period. Okay, any questions? Do you have questions? Do you have questions? Okay, any questions? Okay, do you have questions about your developmental milestones or any? No, miss. No, miss. Okay. So let's answer this question. Okay, let's answer this question. Okay, number one question is, at what age does an infant typically begin to sit without support? Okay, sit without support. Okay, what do you think? Sits without support. Is that 2 months, 4 months, 6 months, or 9 months? Okay, let me see your answer. Let me see your answer. Okay. Okay, most of you answered letter D. Letter D. Okay. So the answer is, okay, sits without support, without support is your 9 months. Because at 8 months, okay, at 8 months, they can perfectly sit without support. So by 9 months, they can already sit without support, okay? Your 6 months, how about your 6 months? What are the changes in your 6 months? Okay, tell me what are the changes in your 6 months. Okay, any changes? Just any developmental milestones that you can recall in your 6 months. Okay, in your 6 months, let me see. Just type your answers on the chat box. Okay, just type your answers. What are the developmental milestones that that the baby will experience in 6 months? Okay, you have there recognize a stranger. Very good. Sits with support. Very good. Okay, how about the others? Okay, I only have here from Jambi. How about the representatives from Padang, Aceh, Tanjung Karang? Okay. How about yes, we have here vowel sounds like a and e. Very good from Aceh. Very good. And what else? What else? Eruption of first temporary teeth. Very good. So from Aceh again. And any
Dari yang
any
lain, dari daerah lain, ayo. Dari
no
Jambi, dari
representative
Padang,
from Tanjung Karang.
Tanjung Karang. Oh, there you go, Padang.
Tanjung Karang. Okay. Padang uses Palmer. Okay, Palmer grass. Yes, very good. Okay, so those are the changes under your 6 months. Okay, now my question is, what are the changes under your 4 months? 4 months, your 4 months of age. What are the developmental milestones that happens in 4 months? Okay, let me see your answer. 4 months. Okay, 4 months is okay, we're done with the 6 months. Let's go to the 4 months. Head control complete. Very good. Okay. So that is your from Jambi. Head control complete. Okay, any? How about other developmental milestones? You have your Babinski reflex disappears. Very good. And you have your bubbling sound. Yes, very good. Okay. How about the others? Okay, so you just need to remember that in your 4 months, this is the time that their head is already controlled completely. Okay, let's go back from 1 year, from 1 month. There, they will experience head lagging. Okay, head lagging, And your 2 months, they will experience to control the they already know how to control their head up, lift their head up when in prone position. In 3rd month, they know how to lift their head up and their chest in prone position. And your fourth month is the head is controlled completely. Okay, very good. So those are the changes in your 4th month. How about 2 months? Okay, 2 months. What are the changes in your 2 months? Okay, 2 months. Okay, let me see the representatives. Okay, social smile. Yes, this is the time that they will able to smile. Okay, they know how to smile. Okay, and recognizes their parents. Yes, they recognize their parents. And okay, how about the others? We still have a lot of developmental milestones in 2 months. Okay, follow object pass midline. Very good. And you have there holds head up when in prone position. Yes, so this is the time that they could already hold their head up in prone position, lift their head up in prone position. Very good. And yes, no longer clinches face tightly. Okay, very good, everyone. So that is for your 2 months. Okay, that is for your 2 months. Okay, next question. Which of the following, okay, which of the following describes a normal developmental milestones for a 9-month-old? Oh, normal developmental milestones for a 9-month-old. Letter A, rolls from front to back. B, cruises or stands while holding on. C, says 2 words, phrases. Or D, begins toilet training. What is your answer? 9 months. 9 months. Okay, what is the development of your 9 months? Okay, 9 months. What is your answer? Most of you answered letter C. Okay. Okay, letter C, letter C. Okay. So in your 9 months, you have there, they know how to cruises. Okay, cruises and stands while holding. Okay, because this is the time that they will know how to creep and crawl. Okay, so that is your 9 months. So if I say, okay, if I say rolls from front to back, what month is this? Rolls from front to back. What month is this? Front to back. Okay, rolls from front to back. What month is this? Anyone? Okay, very good. From Ache. Okay, yes, it's 4 months. Okay, that's 4 months. Okay, so that is your question. Next question, another question. At what age is a child typically expected to start walking independently? Independently. Okay, at what age is the child typically expected to start walking independently, that they could really walk on their own? Okay, expected to start. Okay, that your word is to start. So this is the start that they will walk independently. Okay, what is your answer? Okay, from Tanjung Karang, Dewi says 12. Okay, how about the others? Okay, C, okay. Okay, so that is letter C. That is your 12 months. Okay, that is your 12 months. What is the milestones in your 6 months? In your 6 months, this is your seats with support. Okay, this is your seats with support. This one is your creeps and crawls. Okay, this is your creeps and crawls. Your 18 months, this is already good in walking alone. Okay, next question. Next question. Stranger anxiety typically begins around which age? Okay. Stranger anxiety typically begins around which age? A, 2 months. B, 6 months. C, 12 months. Or D, 18 months. Okay. Okay, what is your answer? stranger anxiety typically begins around which age? Okay, what age? Stranger anxiety. Okay. B. How about the others? How about the others? Okay. B. Some answer letter D. Okay. So let's try to rationalize. Stranger anxiety is the first, what is the first month that they will recognize strangers? So this is your 6 months, okay? This is your time that they recognizes, okay? Recognizes strangers. But if the question is the peak of stranger anxiety, that is your 8 months, the peak of stranger anxiety. Okay? So that is for the developmental milestone. Okay, let's go to your APGAR. Okay, what is the APGAR score? APGAR scoring. What is your APGAR score? We are using this one, especially in newborn care, right? After delivery of the baby, we do newborn care, the cord care, what we call cord care. That is where we will assess the baby, okay, through your APGAR scoring. Okay, so the APGAR score, this is just a quick assessment. Remember that your APGAR score, this is a tool, okay? This is a tool used in 1 to 5 minutes. This is done in 1 to 5 minutes. That's why there is an allocated time for each assessment. Okay, so this is done in 1 to 5 minutes after birth to determine a newborn's physical condition. Okay, if the newborn is well, okay, and or the newborn needs medical intervention. Okay, so this is our quick assessment on how we'll be able to know if the baby is in good condition or the baby needs an intervention. Okay, if the baby needs an immediate medical intervention. So this is the APGAR scoring. Okay, this is your APGAR scoring. Now let's go to your assessment. Okay, assessment APGAR screening test. If you say assessment APGAR screening test, the APGAR score is based on a total score of 1 to 10. Okay, that is the total score. That's 1 to 10. The higher the score, the better the baby. So it should be higher in score. Okay, so if that is higher in score, the baby is doing well. Okay, so a score of 7, 8, and 9, that is normal. Okay, that is normal. The score of 7, 8, and 9 is normal. Okay, now when to assess? Okay, when to assess the baby? Okay, so in 1 minute, okay, in 1 minute, this indicates how well the baby tolerated birth. So how will the baby respond to the after birth? Okay, in 1 minute. Okay, in 5 minutes, this already indicates how well the baby is adapting to the environment. Okay, that's different. Okay, that's different. If you say 1 minute, this indicates how well the baby tolerated the birth. Okay, if when the baby goes out the vaginal canal, how is the baby responding? Okay, in your 5 minutes, okay, in your 5 minutes, there you will observe how is the baby adapting to the environment. Okay, how did your baby adapt to the environment? Okay, and repeat at 10 minutes if score is below 7. Okay, you have to repeat the assessment if the score is below 7. Okay, that is from 5 minutes of assessment. Okay, so that is how you will assess. Okay, when to assess in 1 minute. Remember that you will try to see if how well is the baby tolerating the birth. Okay, in 5 minutes, this will indicate how is the baby adapting to the environment. Okay, and if the score is below 7, because the normal scores are 7, 8, and 9, So if that is below 7, you have to repeat the assessment again. Okay, you have to do and repeat the assessment again. So that is when to assess. Okay, so this is your APGAR score. Okay, this is your APGAR score. Okay, your APGAR score is, okay, APGAR score explains, you have there your indicator. So in your indicator, you have your APGAR. Okay, APGAR. So you have your appearance. That is the skin color. Okay, and you have your pulse. You have your grimace, the reflex irritability of the baby. Okay, and you have there your activity. Okay, your activity, your muscle tone, and your respiration. Okay, now you also have here the points. Okay, how will you give points? Okay, in points, you have there 0, 1, and 2. Okay, 0, 1, and 2. And there you have to give points. You have to give points per indicator. Okay? Okay, now you will have first appearance. Okay, from appearance, that is the skin color. So if the skin color of the baby is blue and pale, okay, blue and pale, you will have it 1 point. You will have it 0 point if that is blue and pale. If you notice that this is pink body, blue extremities, pink body, and blue extremities, okay, that is your 1 point. And your 2 points is pink. Okay, so that is how you will give scores. And you have here your pulse. Okay, if your pulse, if there is no pulse, that is absent, that is 0. So 1 point if below 100 beats per minute. Okay, and 2 points over 100 beats per minute. That is the pulse. Okay, and grimace is your reflex irritability. So you have there, if that is floppy, okay, no reflexes, so that is 0 points. You have your minimal response to stimulation. If you tap the baby and there is just a little response, so that is your 1 point. Okay, if there is minimal response. And you have there your prompt response to stimulation. So if you stimulate the baby by rubbing, they respond. So that is your 2 points. Now you have there activity. Okay, your activity is the muscle tone. Okay, muscle tone. If that is absent, that is 0 points. If the baby flex arms and legs, it flexes the arms and legs, that is 1 point. But if the baby is active moving, that is 2 points. Okay, you have here your R, respiration, your respiration. If that is absent, this is 0. If that is slow and irregular, that is 1 point. If that is slow and irregular. And if that is vigorous cry, that is your 2 points. This is basically the reason why we have to do our APGAR scoring in if we will be having newborn care to the baby. Okay, where we will have this APGAR scoring enable for us to know if the baby needs immediate attention, interventions, okay? Immediate interventions. Because by doing this, we will be able to assess, okay? We will be able to assess the 1 minute of how the baby tolerated the birth, okay? And we will be able to assess in 5 minutes of how the baby is tolerating and adapting into the environment. So this is very, very important. Your APGAR scoring is very important and able for us to assess well the baby. Okay? So we are doing this in our newborn care, and especially if we're doing cord care. Okay? So we assess the baby, our APGAR score. So that's why you have to monitor and to assess this one religiously. Why? Because we don't need to guess this one. Like, okay, the baby 7, looking the baby is 7. Okay. So we have to really assess the baby in a correct manner. Okay, and able for us to know if the baby needs immediate attention. That is our responsibilities as medical practitioners, especially as nurses and midwives. Okay, now, how are we going to interpret that one? Okay, interpretation. In your interpretation, if that is 1 to 3, okay, if that is 1 to 3, that is poor. So this needs immediate CPR. Okay? So that's why you have to do your assessment properly so that you will know how to give interventions. If this is the time that you will give interventions, okay? You will have there 4 to 7. If 4 to 7, this is fair, okay? Needs further observation. They need further observation and stimulation. So you just need to continue your interventions, okay? You need to continue your interventions. While your 8 to 10, is good. Okay? So vigorous cry, okay? Good muscle tone, good flexibility. So this is your interpretation. So it says there 7, 8, 9 is the higher score, so that is normal. So below 7, that's why you need to do something. You need to have immediate interventions to the baby. Okay, so that is our APGAR scoring. So any questions about your APGAR scorings or related to our topic in pediatric nursing? Any questions?
Ada pertanyaan
Any
semuanya sebelum kita
questions?
selesai? Sebelum kita selesai hari ini, ada yang mau ditanyakan? Apakah semuanya
Okay, do we have-
clear?
No, miss. Okay, how about the others? Clear, miss. Clear. Okay. Okay. So thank you. Okay, you're welcome. You're welcome, everyone. And thank you so much. So tomorrow I will give you situations about APGAR so that you will know if how will you rate this one? How will you give interpretation to this one? Okay, so that will be our exercises tomorrow. So I thank you everyone for listening to me today. Thank you for your attention.
You.
Thank you,
Thank you,
Miss.
Miss Joanna. Thank you.
Thank you
Okay,
everyone.
so thank you all, class. Thank you all. So see you all tomorrow. So please ensure that you will be arriving on time tomorrow. So we will start on time as Miss Joanna will be continuing her lecture about UpGar scoring. Okay. So I would like to request all of you to please open your cameras. Miss Mifta, do you have anything to say?
Yes, just besok kita bakal sama persis ya, kayak hari ini, lanjutin lagi sama Miss Johanna on Pediatrics. Jadi mudah-mudahan kita bisa lebih aktif lagi nanti ngejawab soalnya. Yang suka ngilang-ngilang, suka jalan-jalan, tolong duduk ya, stay seated. Waktu ke guru lagi jelasin segala macam, lebih baik kita semua duduk yang tenang, oke? That's all, Miss. Let's take a picture. Kita kameranya tolong bukain dulu semuanya. Mau difoto sama Miss Nada. Oke, satu. Yang pertama, satu, dua. Oke. Yang lain, kameranya dudukin
Smile.
semuanya.
One by
Smile.
one ID picture. Smile.
Oke.
Okay.
Okay, so we're done taking a screenshot. Thank you all, class. Thank you for attending today.
Thank you,
Okay, so
everyone.
Semuanya.
congratulations to everyone. All right, so we'll continue our class tomorrow. Okay, so thank you, Miss Joanna. Thank you,
Thank you.
Mifta. Thank you to
Thank you,
all the
Miss.
Thank you,
focals
Miss.
from
Thank
Tanjung
you, Miss
Karang,
Nada
from
and Miss
Pache,
Nita.
Jambi, Padang. Okay, thank you all so much. Bye.
Bye, everyone.